Good morning and welcome to this special board study session on the reopening of our Ventura Unified School District schools. My name is Sabrina Rodriguez and I'm currently the president of our Board of Education. I want to thank all of our staff for participating in this so bright and early on a Friday morning. It's really important for all of us to have your voices here so that we can ask you questions and also understand better your perspectives, and want to specifically thank our association presidents for being a part of this because of course they represent many voices. If you would please join me in standing for the Pledge of Allegiance. Ready, begin. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. And Ms. Dahm, would you please take roll?
Sure, I'd be happy to. Trustee Dr. Jerry Dannenberg.
Here.
Trustee Mr. Matt Alvarez.
Here.
Trustee Ms. Thelma Lomax.
Here.
Vice President Ms. Jackie Moran.
Here.
Board President Ms. Sabrina Rodriguez.
Here.
And Superintendent Dr. Roger Rice.
Here.
Great, thank you.
Great. Dr. Rice, is there any need to amend the agenda that was presented?
No.
Great. So do I have a motion to adopt the agenda?
Move to approve.
Second.
Okay, vote as follows. Trustee Dannenberg.
Yes.
Trustee Alvarez.
Yes.
Trustee Lomax.
Yes.
Trustee Moran.
Yes.
And Trustee Rodriguez.
Yes.
The motion carries 5-0.
Great, thank you. So do we have someone there for public comment?
No, there's no one here today.
Okay, great. And we have not received any public comments via email. So we can go ahead and get started. Dr. Rice.
Thank you, Board President Rodriguez, members of the board and administrative staff. It's great to see you all here this morning. I want to start just by thanking everyone for taking time out of their Friday morning on somewhat short notice to spend so much time with us. We do have 4 hours budgeted for this important study session. I also want to thank our association presidents, Dan Nelson and Carol Peak, for being with us this morning. Their perspectives are completely valued, and they have a lot of information. I'm sure Dan will be ready to speak to some of the surveying he's done, so we can take into account how our teachers are feeling and some of the things maybe we can do as a board and as a staff to make the jobs that they do more tenable and more effective for our kids. The purpose, as I see it for today, and as was requested of me by the board, was to provide an opportunity for the board to have a discussion about their decision in July to stay on distance learning through the end of first semester in light of the many developments that have been happening relative to the COVID-19 situation here in Ventura County. And so in order to lead us through what I think our agenda would look like today, what I'd like to do for a minute is share my screen. So I'm gonna, I don't know if that's enabled.
Sorry, let me do that.
Okay.
You're good to go.
Okay, perfect. I assume everybody sees that. Thumbs up. Yes. All right. So first thing I want to share is that in the past, the board has asked that we reserve most of the time allotted to these study sessions for board discussion and for questions and answers, and try to minimize the presentation of material to the degree possible, knowing that, you know, there's some really relevant, important information that they need to hear that would weigh in on their thinking and on their discussion. So today's presentation might push the limits of that expectation a little bit. I'm going to try to get through it as efficiently as possible, but there's no getting around the fact that there's just a lot of material and a lot of ground to cover with such an important decision before us. And so one of the things that the board has asked us to do when we have these study sessions is to have kind of a set of guiding questions. These are obviously able to be amended, and I do have one slight amendment that I was discussing with the board president yesterday evening, and I'll share that as a possible number 4. But the first guiding question is to have an opportunity for the board to discuss and to be informed about whatever has changed since the board decided to remain on distance learning only for semester 1, and that was back in July. So obviously we're in the beginning parts of October. That's quite a bit of time, and lots has happened. The second guiding question would be to delve into what progress has been made to address these changes and return at some point to in-person instruction, which I know is ultimately the goal of the board and the community. And then number 3 is what challenges remain and what recommendations would staff have for the board to consider as options moving forward. I mentioned just a second ago that there was a possibility of having a number 4, and for the board's consideration, the idea was raised to include, time permitting, an opportunity to talk about any potential tweaks to the distance learning. And I use the word tweaks on purpose because at this point, we're past the point of making wholesale changes. We are where we are, and the program is pretty well in place. But I was asked to consider the opportunity for the board to ask questions or make suggestions about what staff might be able to do to improve the delivery of our distance learning program during the time that we have left in that program, whether that's until the end of the semester or some other shortened period. So I would look to the board for consensus on adding that as number 4.
Board.
I would,
That's good.
I
Okay.
also agree.
same.
I didn't hear Velma, sorry.
You didn't see my thumbs up? Okay.
Oh, okay. There are a lot of squares, sweetheart. Okay, great. So if there is time, if not, we can certainly push it to next Tuesday.
Okay. So I'm going to give a little bit of background and context. And as I'm doing this, I would like to share with the board that we invited our guests from public health, Rigo Vargas and Dr. Levin, Robert Levin from Ventura County Public Health, to be with us this morning to make a brief presentation on the situation related to COVID-19 and the state's rating system and developments as they see them, and then also give the board a chance to engage in a question and answer session with them. I think that's extremely valuable. That's a great opportunity. And so Amy, the timing may not be precise, so if you could just butt in or wave at us or somehow kick us under the table to let them in as soon as they're here, we can transition to allowing them to get started as soon as they're here, whether it's in 2 minutes or whether it's in 15 minutes. So
Okay, sounds good, Dr. Weiss.
thank you. So if you recall, our board made a decision in July to remain on distance learning for semester 1 only. At that time, because in my perception of the rationale for that decision, that the length of time between July and the end of semester 1, which is at the end of January, left room for a great deal of change, which we're now experiencing. I think that's probably why the board has, since that time, repeated the desire to reconsider or reevaluate that decision if there were substantial changes in the community situation or in the district situation, which is why we're sitting here today. So I think that's wise, and I think that shows prudence, and I think it gives the community confidence that we're being thoughtful and deliberative and not just rushing into undue pressure or sticking with a decision even in the face of dramatically changing circumstances. So I applaud the board for the wisdom of that decision. I would remind the board and the community and staff that at that time, the board did approve a hybrid learning model that we would return to if and when we do return to in-person learning. And that model, I won't be going into the details of that. I think that's more appropriate for Dr. Bayless and Ms. Wolowitz later on in the presentation. They can run down what that schedule looks like, especially as it pertains to some recommended adjustments to that model that you approved in light of the learning that we've had over the past 6 weeks. We have had an occasion to hear from parents and students and board members and staff and principals and teachers and support staff about things that are working and things that maybe we should think about adjusting moving forward. So a reminder that we're still relatively new at this. We started the distance learning program on August 17th. We ran an orientation period where we gave students and staff an opportunity to get comfortable with the technology, get comfortable with the distance learning program, as much as can be done in 2 weeks. And I say that because the initial plan did not include an orientation period, and yet after having gone through it, we could have easily extended that to 3 or 4 weeks. But then you risk the balance of upsetting the beginning of instruction, which needed to have happened as soon as possible as well, of course. So that instruction happened in earnest, began in earnest on August 31st. So we're about 6 weeks in. So we're still pretty new at this thing called distance learning, but we've also had a chance to, as I said earlier, gauge what's working and what's not. Also, I don't want to go into great detail about the state rating systems because we do have guests that are going to talk about that. But what I will say is that recently the state ratings came out this past Tuesday to move the county from the purple tier, which is the most restrictive tier. And a reminder to the community, staff, and board that under that most restrictive tier, schools in those counties so rated are precluded from opening public schools in the absence of a waiver, which would have entailed filing a completely individual plan to start instruction, even given the being in the purple status, the most restrictive tier. And there were 1 or 2 districts in the county that felt that to be appropriate, and the rest of the 18 or 19 districts chose not to file a waiver. And now as we move forward from the purple tier to the red tier, which is 1 tier below the purple and less restrictive, the waiver would not be required to reopen. The idea is that in order to demonstrate consistency and confidence in that status, that 2 weeks would have to pass by from the time that we were so identified until schools would open. And so, as you have read publicly, probably many times since then, school districts in Ventura County can legally open their doors on October 21st. I say the 21st because we've been told that an announcement would be made sometime midday on the 20th. to the effect that the county successfully maintained their tier status. So yeah, go ahead and open tomorrow. And knowing that it's not likely they would announce the opening, that the okayness of opening schools on the 20th and then have people open that same day. So that's why the 21st and not the 20th. Do I have questions so far?
Nope.
Nope. Okay. So I'm gonna skip this, except to say that on letter C, and perhaps if you have questions about this, our guests from public health can address it. The state did implement an equity measure for public health that seeks to compare the health outcomes in what amount to lower socioeconomic status zip codes and neighborhoods to make sure that those areas of our county or the counties across the state are not being left behind. We're very familiar with that type of model, given the California dashboard and the significant subgroup model in the models that have been present in holding schools accountable for their performances for many years. The term achievement gap is the closest analogy I can put to this. And I applaud the state for putting that measure in there, because I don't think it's appropriate to just look at the progress made in counties where all of that progress were to occur in the more well-off communities. That we need to bring everybody forward and work for positive health outcomes in all of our neighborhoods. And I'm sure they will share with you today that the initial ratings from that equity measure are positive and would not preclude us from moving forward. They're within the range that would allow us to move forward. I'm not going to go into moving back, but what I would tell you is my understanding of the new rating system is that once schools open under the red tier, that they would not be required to close wholesale in the absence of hitting certain targets, depending on the number of infections you have at a particular site, within a particular cohort, at a particular school, and that the closures would happen in a more targeted and specific way to include results of individual investigations and contact tracing, as opposed to just saying, there was a positive case at one of our elementary schools, so let's shut down the elementary school. That's not how it would work. How it would work would be once schools decide to open under the red tier, even if the county went back to the purple tier, schools are not required to shut back down. They would just deal with individual positive tests through contact tracing and quarantining of students or staff who are positive. So this is talking about, I'm going to skip down to number 3 and talk a little bit about the small cohort guidance. You may remember, but for the community who may be watching or viewing this later, the state also came out with separate guidance to allow small cohorts of students to get together, even in counties where they are in the purple tier, the most restrictive tier, to allow for specialized services for students who may be in need of those services, to include special education students, English learners, and that could include things like physical therapy, occupational therapy, speech, EL, academic interventions, academic enrichment, and so on. They also allowed, and we'll talk about this a little bit later, they also allowed small cohorts specifically for sports, conditioning, and skill building in socially distant and under a comprehensive safety plan, which I've shared before. And that has been going on for, I believe, 3 weeks now here in Ventura Unified without incident so far. And we're pleased to report that so far knock on wood, the plan that the coaches and athletic directors have been so diligently developing and implementing has worked well. We also got approval to have small cohorts in robotics under the same set of rigorous safety standards that include no spectators, no competitions, outside as much as possible, face mask, social distancing, all of that stuff. That's been going on for a week or two less than the athletics because it took us a little time to get that plan in place. And then just recently, we received approval from Ventura County Public Health to have small cohorts come in to support music, with the caveat that the music be strings and percussion only, no wood or brass or singing, those types of activities that would tend to spread droplets and therefore the virus. So we were pleased to get that guidance, and Dr. Bayless had conversations with the district's music teachers to ascertain how many might be interested in that. And Dr. Bayless will be on the call if he's not already, and he can share with you like how many express interest. But I believe we have at least 2 schools, Ventura and Cabrillo, that would likely jump into the small cohort activities for music. So I want to share with the staff and the board and the community that the incremental approach to returning kids to in-person activities and instruction is in swing. It's not yet in full swing because we're being incremental about it, but we are making great progress in bringing people back where it's safe to do so, where the permission has been granted, and where we can control the variables and learn from our experiences. And so we have at least 2 groups right now and a third on the way. And we'll talk later about the development of small cohorts during the later part of the agenda, because that's an important way for us to get kids back into connecting with each other and with their teachers in a productive way. So I'm getting a little bit into the presentation. I'm going to skip through that a little bit because I think all of those slides would be covered by Ventura County Behavioral Health, and we'll go back to those if we need to. But what I would share with you is we're almost at 8:30. Amy, are our guests present yet or not yet? No? Okay. Thank you, Amy. What I would share with you is that as we move forward, and we'll get some of these other slides out of the way to free up time later, is the major considerations that we have really haven't changed. The board has said from day one, they wanted us to make sure that we first and foremost protected the health and safety of our students and staff. We've tried really hard to do that. I think we've done a good job of that. In addition, though, we have to keep in mind front and center our primary goal, which is, of course, to educate kids. And we know that happens best with in-person instruction where kids and teachers are together. And so we want to make sure that as we are making sure that our students and staff are safe, that we're at some point when it's safe to do so, get back to in-person instruction, knowing that the benefits of instruction, academic achievement, the social emotional benefits of kids being at school with their peers and with their teachers. There's an undeniable reality that the district's enrollment, and probably not just our district's enrollment, probably many districts' enrollment is suffering greatly from the current COVID status and the distance learning programs. There are now private school options who we can talk about later about what all the circumstances are that have allowed them to move to in-person instruction that would not be consistent with large public districts doing the same. But nevertheless, there are private schools in the area who have opened up their doors to in-person instruction. And then the economic realities for our families has meant that they have relocated outside of the state. We've been trying to track why our kids are leaving, but the enrollment issue is one of great concern. Had a chance to talk to staff about that the other day and mention it to our VUEA president last night, that We're down about 500 students, which is more than we had projected. And so we're going to need to do some work on that. And I believe that at some point when we return to in-person instruction, there are benefits associated with kids who will probably return to the district once we are back to in-person instruction. So during the presentation today, I'm prepared to share with you progress that we've made and preparations that we've made in the following areas. In terms of safety, we are going to hear from Ventura County Behavioral Health about how the community spread of the virus situation has improved. We are prepared to share with the board how our logistics would work, knowing that no waiver would be required as of October 21st. I'm prepared to talk about results of a parent survey that went out, as well as a staff survey that went out. Our staff survey was limited to asking our folks their willingness to return or their
Dr. Rice, I apologize for interrupting. I just wanted to let you know that Dr. Levin has now joined our call.
Okay, I'll wrap this up really quickly and then we'll get him right on. A more robust survey that gave a more open-ended questions to staff was put out by Dan Nelson and VUE. So I'm sure he'll be willing to share with some of the suggestions and ideas and perception they have. We are ready to share with you some models for classroom setups that we think will work, as well as some opportunities to talk to you about our cleaning and PPE protocols. And then, as I said earlier, we would be prepared to talk about incrementally adding on to the small cohorts as we work towards full return to in-person learning. So with that, I think that puts us several slides ahead of where I thought we were going to be. So that's great. And I'm ready to turn it back to you, Board President Rodriguez, for introduction of our guests.
Great. Thank you, Dr. Rice. Appreciate that. Dr. Levin, we saw that you were able to join our meeting and really want to appreciate your time and participation. I know you're incredibly busy, and having you here to be able to share your expertise and kind of give us an update on where we are as a county is incredibly valuable to us as we look to move forward. So really want to make sure to share our deep appreciation for that. Do you have a presentation you'd like to share?
You know, Rigo is going to get online, I think, in just a few moments, and he'll give an update of the numbers in our county. And
okay.
Other than that, that was our presentation.
Okay, great. So then we will continue. We just wanted to make sure to honor your time. We'll continue, and when Mr. Vargas joins us, then we'll pause again for your presentation.
He'll do it. He'll join any moment.
Okay, perfect. Dr. Rice, would you prefer that we just wait here, and if board members have any questions on what you've presented up till now? Okay. Dr. Dannenberg, any questions?
No, not at this time.
Either from just waiting for the rest of the presentation.
I had a question. I'm not sure if this is the appropriate time to ask it, but maybe Dr. Levin might know where this came from, but there's a rumor that VCOE had a Ventura County Office of Education publicized that only grades 3 through 5 would be required to wear masks. Is that something that the county has control over? Is it that, or do we as a district have control over that?
You as a district can be more rigid or limiting than other rules that are passed down to you. So in terms, and I see this all the time in the county, the state will make some kind of pronouncement, or maybe 10 pronouncements, and 8 of them will be fine, but we'll want to have the restaurants close at 10 p.m. instead of just the state statement, they can be open. So what I know that the state has said, what I think the state has said, is that from 3rd grade on up, masks are required, but that from kindergarten through third, or from 2-year-olds through third grade, they're highly recommended, I think is the language they used. And if you wanted to say required, I don't see anything wrong with that at all. That wouldn't conflict with state or county public health.
And Dr. Levin, we talked a little bit about this yesterday with the rest of the superintendents. Would that be your best professional judgment in terms of our best practice that you would like to see happen?
I like the words you used, because I don't want to require it, because you guys are on the front line there and have to deal with these things. But I would, to use your words, I would like to see that happen. I know kids from about 2 years of age on up can wear a mask and feel very comfortable doing so. I also worry from the other end, and I think I've expressed this yesterday, that kids are going to show up without a mask, and it's not going to be clear, even if it comes with a doctor's note of support, that it's because of truly medical reasons or for political reasons, for their parents' political reasons. So, or just parents who say, I don't want my little Johnny to have to wear a mask all day. I mean, there's that too, of course.
Thank you.
That's all I had. Thanks.
Sabrina, you're muted.
That's what happens when you're talking and you can't hear yourself. Thank you, Dr. Levin. Mr. Vargas was able to join our call. And so, Mr. Rodriguez, we want to sincerely appreciate your time and participation in our board meeting. It's really helpful to hear directly from public health and from the experts in the field, and have you share your experience and sort of the current situation. So we understand from Dr. Levin that you have a short presentation that you're interested in sharing with us.
Sure. Good morning, board members, Dr. Rice, and good morning to Dr. Levin as well. And so, yeah, I believe there was interest on your behalf also to just get a quick summary recap of some of our metrics with regard to the movement with the tiers, between the tiers of the roadmap to reopening and the new blueprint that the governor announced a few weeks back. And then I do have the zip code by, I mean, some of these rates by zip code. And so I believe Dr. Rice may have the latest. If not, we are going to be updating this information on a weekly basis on Tuesdays to coincide with the governor's and the California Department of Public Health's announcement on every Tuesday on the counties, all counties in California metrics. And then what we will do then is add additional detailed information and release it out by zip code, and also to coincide with the new health equity metric. So I do have some specific information to your school district by again by zip code. You may have seen it, so I won't go too much into detail. But again, yeah, I can make that available even what we have this week. But again, moving forward, you'll have that information so that you can see the actual week over week trend with regard to the two critical numbers that all counties are being monitored for with regard to movement within the tiers, in which, of course, we know that involves number of cases and also the test positivity rate. And so for those numbers, as you know, as a county, overall, we continue to trend well. In fact, for us to have moved into to this second or red tier, we needed to have a sustained decreased trend in those two indicators. And on the first week of the 2 weeks that we needed to have those numbers, we came in just right at the maximum level of 7 cases per 100,000 resident. But this week, when we formally enter the red tier, allowing those sectors for a phased-in reopening of their businesses, such as restaurants at 25% capacity, we came in very well under the 7. Our actual number would have been 6.2, but then we have an adjustment factor for our excellent testing capacity throughout the county. And so we got an additional adjustment that made our case rate at 5.5. And so, our testing positivity rate has actually been very, very good. We're at 3. The goal have been to be under 8. So clearly we're doing very well in that metric. And again, this is county-wide, but I do have this information by your zip code. The numbers, it is important to, of course, you understand being on the front lines, these numbers change and they fluctuate on a lot of factors, namely, when there's a, even a small outbreak could impact our numbers. For a while, in fact, we weren't able to get in earlier into the track of the new tiers because of the numbers from the outbreak in the jails, and so mainly actually the main jail, not so much the Todd Road jail. But yeah, an outbreak like that does concern us, but we do have all the necessary staff to do contact investigation, do tracing, to work with you guys closely, and anyone other industry or sector. And so again, it's important that these numbers are trending well, and we expect, because it's been a sustained trend, that we'll expect improvements all throughout our areas. And the quick word on the health equity metric, that one, counties are not able to move tiers if the highest what would call it, the highest poverty and other socioeconomic status communities have, if they have higher numbers, which we do in our county, corresponding to the greater Oxford Plains, mainly Santa Clara Valley, but zip codes and census tracts throughout the county, if those that are of lower income and high density, if those zip codes and census tracts don't also improve and show a continued downward trend, then counties are not allowed to move tiers. So we're pleased to say that while the case rate and the testing positivity numbers are a bit higher in some of these communities that I mentioned, they are continuing to trend lower. And in fact, our health equity new metric that is now added to this system of moving between tiers, our numbers are very good. Those numbers also would even put us in the, for the health equity metric, they would put us in the 3rd tier. So, again, I want to stress that these numbers are improving. Of course, things can change, but right now we feel that we're continuing to trend in the right direction. So that's kind of just the quick overview on your zip codes corresponding to Ventura. We have had a few cases where it involves long-term care facilities, so congregate settings. There's a lot of discussion at the state around some adjustment factor for congregate setting outbreaks, in that they're for the most part contained, within the residents. And yes, there's staff that come in and out, but also there's very strict protocols to try to mitigate and contain outbreaks in congregate settings. But your rates in your zip codes would even be a little bit better if we had not had some congregate setting outbreaks the last few weeks. Not huge, but again, they do impact currently our rates. We don't know if that's going to remain stagnant in terms of the congregate setting numbers impacting overall zip code numbers. So I know I've mentioned a lot here. I've had already a lot of coffee ready for the day. So then why don't I pause there? And again, I can make these slides available to Dr. Rice, and just knowing that on Tuesday they'll be updated.
Great, thank you very much. Board members, did you have any questions?
I have a question for Dr. Levin. He's been widely quoted as saying schools should open and that it's safe to open schools. I'd like his opinion on that.
I'm not sure that I said, I'm not saying that it's not, but I'm not sure that a quote is correct to attribute to me to say that it's safe to open schools. But yes, I want to encourage schools to open. I really wanted to encourage the public schools to open because of equity issues, because of disparity issues, because of kids falling behind. And I'm anxious to see that happen. I confess that I don't know the realities, the obstacles that you have to deal with. I have it simplified to the fact that unions are probably very problematic, but there are probably a myriad of other obstacles as well. But please explore that a little bit more. What was it that you wanted to talk about concerning that?
Well, since you've been quoted that, I guess my biggest concern is, what are the safety issues in your mind that we have to deal with?
Okay. Boy, I'm going to ramble. One, risks are going to vary based on what Rigo was just talking about, what Mr. Vargas was just talking about, and that is how much is in the community. Something that every school can do to maximize safety is to focus on every class and make sure that each class is as safe as can be. And that has to do with social distancing, wearing masks, noticing if a kid is not doing well, and noticing that if another teacher or yourself not doing well, should be home. Good hand washing, as much as possible outdoors, a good ventilation in the classroom when you're indoors. So every single classroom should be a bastion of safety. And then keep in mind that a statistic that I heard the other day, you may or may not have heard this, you may or may not have heard me say it. And that is, if you look at one or two hospitals, representative hospitals in our county, Ventura County Medical Center and Santa Paula Hospital, they obviously have taken care of a number of patients with COVID. People are at risk there all the time. They have now done voluntary antibody studies on the workers, everything from doctors to housekeepers to nurses to cafeteria workers. And the antibody studies are interesting. They will tell you not only who has recently had, but who has ever had COVID infection. So this is the number of people working in close contact with disease who have had it. That number turned out to be 2%. This study was done a week ago, maybe two. And secondly, what was the other statistic? Oh, yeah. Whenever anyone who worked at one of those two hospitals was ill, they were required over these last 6 months to get a COVID test. The percentage of positive COVID tests in people who were sick in that population of workers was 3%. So, yes, it's something to be concerned about. It's not everywhere. It's not. You can defend against it. You can protect yourself. And it's an infectious disease, but it is not wildly infectious. A number that people use sometimes is a number that talks about how many other people each person who gets it infects. And early on in this outbreak of COVID, it was in the 2 to 2.5 people range for each case. Now in Ventura County, it's one. One person gets it, about one other person gets it. As a standard of comparison, for measles, it's 16. So it's an infectious disease, but if we take precautions, if we're careful, we can go a long way to protecting ourselves and others. I told you I was going to ramble.
Thank you.
Dr. Levin, trust me, they're used to it.
So,
our meetings are regularly very, very long. So, Dr. Dannenberg, did you have any other questions?
No, not at this time.
Okay. Mr. Almaraz?
Good morning, Dr. Levin and Dr. Vargas.
good morning.
To your knowledge, have you had any outbreaks at any of our daycare centers in the county or in the city limits of Ventura so far?
Maybe because they're so small, I'll admit to the fact that something might have happened, but the answer is no. That means maybe there's been, and I'm saying, this is theoretical. Maybe there's been a place where there's been 2 or 3 cases. Rigo, do you know of any place?
Same thing, something, you know, a small 1 or 2 could have happened, but I'm not aware of, and certainly not in Ventura specific. So yeah, and just for clarification, as much as I would want to hold a doctorate, I'm not a doctor, but thank you. Thank you.
Also, have we had any cases at any of the schools, private or public, in the county that have recently reopened?
Not that I'm aware of.
Okay. None of the waiver schools that we're aware of have had any of any cases. You know, there's been a few cases involving staff or personnel not related to school reopenings as limited as they have been, and that usually it's involved 1 or 2 against staff person that's been working more on the administrative side. And this is not recent. It's been through the last few months. But yeah. So
if a student was to have a positive case, that would that information be shared with the county? Obviously, it would then go hopefully back to the schools, but how would that go into effect? If a student became infected or a teacher, how would that information be disseminated?
It would be disseminated probably in 3 ways. The most consistent and reliable way would be every case is reported to our nurses. And if we had a case reported in a kid, the first thing that they would ask is, what school is this kid in? But also, rumors are going to get around. I mean, it's probably pretty hard to get COVID in our county, and for other people not to know about it. And I think that's going to come to the attention of people at the school. There's going to be a lot of tattling going on. And then you have a couple of COVID people appointed at each school to be communicating with our COVID nurses. And they're going to be lightning rods for this kind of information as well. I don't think we're going to have many cases that we're going to miss, at least diagnosed cases.
And I know at the start of the pandemic that results were taking a little bit longer to get back when you did have a COVID test. I've heard that the testing at the fairgrounds is almost a 24-hour turnaround. If we as a district go back to school, one of my big concerns is the amount of time the results would be given back. Do we have county support to make sure that there is almost a faster way for students and teachers and staff to get COVID results in a quicker manner?
Quicker than the 24 or 48 hours that we already consider pretty quick?
Yes, because my biggest concern would be a student comes down with possibly with COVID, and then we're waiting 24 hours to quarantine a class because we don't have results back that there is actually a positive. Different from flu, we're going into flu season.
Well, this goes back to what I was saying about each class being its own little bastion. Let's look at that. We've got 14 kids in a class and a couple of teachers, let's say. One kid gets a fever and maybe a cough, is immediately pulled out, right? Goes home, gets tested, hopefully on the way home. I went through testing the other day, and I had my result texted to me 20 hours later. I'm happy with that time, but let's continue back on that vein with that student. So the student's at home now. The student finds out that he or she is positive and notifies the teacher. And at that point, the 2 people who are appointed at each school who will have had some training will come in and look at that classroom and ask some questions. And they may determine that only the 3 or 4 kids sitting around this kid is are worthy of quarantine. So that classroom may continue to function, less those other kids. Does that answer your question?
Yeah, and that would be basically good for our elementary level. Again, my concern would be our secondary level, because we have so many different students taking different classes that they wouldn't be really connected to just a small cohort. They would be mixed in with multiple different classes.
You're absolutely right. And, you know, if it were up to me, I'd like everybody to be in, you know, I'm not serious about this, so please don't quote me. Dr. Dannenberg, don't quote me. I would just love to see everybody in their own cell, right? Because if you're in your own cell, then you can't interact with somebody, and there's not going to be any disease passage, right? So that's the way to stop this thing, right? But that ain't going to happen. And who really wants that to happen? Okay. Having said that, if you make each classroom as tight as can be, even though you've got, for when that classroom is meeting, let's say it's a math class, and you have kids in that class after the class, they're going to be leaving and going off to their other classes. And then you're going to have other kids coming in. But if each time you have a gathering of kids, you have an environment there that minimizes the possibility of the transmission of disease, I'm hopeful that things will be contained. Again, this transmission is not measles. This transmission is basically 1.0 or 0.98.
And my last question is just, in the coming months, do we have an estimation on the possibility of the increase of the numbers going into a more of a cold season, flu season? And with that, what do you see from the county level or perspective, the possibility of us, if we did reopen in the coming weeks, the possibility of our schools having to close down if there was an outbreak?
We're in the red, tier 2. If we have to move back to purple, the schools will not have to close down. They can stay open. Now, if you have an outbreak, there's outbreaks and there's outbreaks, right? So there's a kid, and then there's maybe sometimes nobody around that kid, and sometimes 3 or 4 kids around that kid. And then there is a classroom possibly closing. At the higher levels of education, you might see more than one classroom closing. It would probably take 3 classrooms closing, and it would also depend on the size of the campus to close the whole place down. But even then, the whole place might not be closed down. We're getting better and better, and this touches back on an earlier question you asked, at getting rapid testing. And one of the places we're at right now is we have antigen testing, which isn't as good or accurate as the polymerase chain reaction testing, PCR, but is pretty good. And that can be a 15-minute test. So maybe that will be a useful tool to help support this. Wintertime, we worry about wintertime with flu. We have to be more worried in Chicago than here in California, because people really are forced to come together indoors and stay indoors. We're already quarantining now. And so when we come together indoors with COVID, we're less likely to come together indoors with others that aren't in our household, unless, of course, it's at work. And then that's, in some ways, its own cohort. So will we, I guess another question one might ask, corollary, is there going to be a surge? Everyone says there's going to be a surge, that we're going to see more cases. It's not just going to be in the schools, it would be everywhere. I would love to believe that we can be different, that we can be a county, and I don't know how to get this message out by myself. Maybe it's very effective getting this message out through schools and kids. Kids are amazing in terms of educating parents. They can do that in terms of cigarette smoking. They can do that in a lot of things. They can do that with COVID. So I would love to see us be a county that really behaved responsibly over Thanksgiving and Christmas. Still, we're going to get gathering guidance from the state pretty soon. That might say 3 households can get together consistently over time. Maybe confine your Thanksgiving to those 3 households or your Christmas to those 3 households and celebrate in that way. But if we're responsible, I feel that we can avoid a surge. And that's crazy talk probably to a lot of people.
Again, thank you, Dr. Levin and Mr. Vargas for being here. I really appreciate it. And that's all the questions I have. Thank you.
Thank you.
Matt, you asked most of my questions. Thank you. Dr. Levin, I do want to thank you and the county. I got my test results within like 23 hours, 24 hours, something like that. It was very nice to, and while I was waiting, I did isolate and not even walk with my friend. And I appreciate your willingness to be here with us. And actually, Matt, you answered all my questions, so I would have no further questions.
Jackie?
Sorry. Hello. Yeah. Hi. So, Dr. Levin and Rigo, both thank you for being here. And I'm glad that you gave this presentation. There's a couple of things that I have. One, I want to applaud you for considering taking out the community spread counts for elderly facilities and jails, and because I really think that ticks our numbers up. I've seen it happen, and those are encapsulated, so it's separate from community spread, even though there are staff workers that go back and forth. So thanks for that. I wanted to ask the protocols for positive students and staff after the hybrid model is put into place and we return to some sort of school activities in classrooms, even with the cohorts moving between each other in secondary school. Can you give me an example of what might be the musts do versus the may do sort of protocols for you? I know in hospital settings, your sort of matrix for exposure would be 15 minutes, not socially distant and without PPE is a direct exposure, and that would require quarantine. But absent that, if you have PPE or if you're not 15 minutes, it's sort of it's up to the protocols of the facility itself or the business place itself. So can you give us what might be your musts and mays with schools, with a positive student or staff?
I think, well, I can answer that tangentially. Maybe for starter, maybe I'll be able to work my way in. And that is the 2 people at each school who are going to be doing some evaluating for who are contacts and who aren't will have some training from our communicable disease nurses. Hopefully there'll be some consistency from school to school as a result of that training. It's hard to answer your question without a for instance kind of presented. Just kind of in general, it's really hard to
I can give it for instance if
Okay.
that would make it easier.
Okay.
So we'll give it for instance. I'll go in the secondary school because it's more complicated than it is in the primary. So you have a student that has 6 classes, and the student turns out to be positive for COVID, not for a cold, and the student notifies, and we'll get to that question in a minute, but the student notifies the school that they are positive for COVID, and of course, immediately you'd look up all the classes that student has been in, for the last week or 2 weeks, to try to figure out who that student has come in contact with. So can you tell me, at the notification of that positive student who has tracked from class to class, given the fact that they are wearing PPE, so that's going to be a requirement of the district, and that their desks are apart, but there's some sort of, they pass each other in the halls. They might sit together, in a group of 4 outside for lunch, something like that. So what would be the must do's versus up to us to create a protocol for?
This is kind of like, I know you want like a really solid outline answer. This is enough like the realm of medicine that
Okay.
it's an art and not a science.
Right.
So the COVID people at your school would come in, and maybe they'd even call in one of our nurses if it was really complicated. And they would identify the kids that they thought might have been in closest contact. They would send those kids home, but on the way home, they would ask them to get a COVID test. So a lot of what we do communicable disease-wise with any communicable disease, not just COVID, is we look for concentric circles. We do this all the time with tuberculosis. So if there's a high school of 1,000 or 4,000 kids, we have a kid with TB, we check the kids around that kid in the classes the kid takes. If they're all negative, we pretty much stop there. But if one of them is positive, then we look at the whole class. And now if we find 3 or 5 of those kids positive, so it's just expanding circles is the approach.
Okay.
And it's just day by day.
Okay. So, if a student is positive, we check the students around them, closest to them in each class.
Mm-hmm.
Who does the testing for the students in those classes?
The testing is right now the way we have it, Mr. Vargas and I have it conceived is that students will go to a free testing site in the county. There are a number of them, and they're geographically spread throughout the county, and they happen to have pretty rapid turnaround. So on their way home for a day of quarantine, they would stop off and be tested. And by that time the next day, hopefully they'd have a response.
Okay. So the closest students would be the ones that you would test. So for the must and may in this scenario, would those students be required to quarantine until they have a negative? And would they do the test on the 5th day, the 8th day? So would they have to quarantine for 8 days in order to come back to school? Would we just watch them? What would be your must or mays with that?
They would quarantine, and this is as close to a must as I'll come in the series of questions, and that is they would quarantine for 14 days. A negative test would not get them off the hook.
Okay, so all right, so I'm just tracking here.
Mm-hmm.
So if and that's without being identified as actually having a direct contact. That's just with having a student in their classroom that had a positive, even though they were 6 feet apart most of the time and they were all wearing PPE, they would still be required to have 14 days of quarantine.
And again, there's a judgment issue involved here. If people were together outside and if the spacing was even more favorable, et cetera, people might feel that the nurses or the contacts, the COVID workers at the individual school, they might say, we're going to test these kids, these 4 kids in this outside setting for the better part of valor. We really don't think that they were close contacts, but you know what, let's just be certain. Those kids might not be called close contacts and might not be required to quarantine. Again, there's judgment involved. Okay.
So have there been any outbreaks in Lowe's, Trader Joe's, Vaughn's, the businesses that were essential and had to be open from the onset? Were there any sort of outbreaks that required their staff to all quarantine or a significant portion of their staff to be absent from work during this?
There have. Do you really want to confine it to this county, or do we want to look
the county
widespread? Okay. I think there's been some like restaurants that have had a number of people there who were positive, and I don't know if they closed or not. Maybe Rigo can help me with this. I don't think we've had any big stores like a Vons
Or Lowe's.
or a Lowe's close. There's no way that that's happened.
Or Trader
Rigo?
Joe's.
Or Trader Joe's. What do you think, Rigo?
I've not heard of us being involved in the actual closure of such businesses. A few have closed, for overnight or a couple of days to disinfect. So some of that has been, with our guidance. Others we've just taken extra precautionary measures and closed again for a limited time to again re-inspect the whole facility, check the protocols, and disinfect. But I'm also not recalling any particular outbreak at such a setting that was at a level that we had to come in and close down the facility for an extended amount of time.
Okay, so I'm just trying to work through the musts and the mays. And given that only 3% of the hospital staff tested positive, according to the presentation for the antigens, even though they've been in close contact with people and patients who have had COVID, the childcare businesses have had no real outbreaks. Having children must stay out of a school for 14 days is disruptive to education. And a may is different than a must. So given that this is a one-to-one transmission with the protocols being adhered to, so I'm guessing that that's the case, or actually it's probably without them as well, right? It's the one-to-one is what we're giving community-wide transmission rather than measles, which is 16-1. Was that the gist of it, Dr. Levin?
I'm not sure I understand the question.
So the one-to-one transmission rate that you gave, the 1.0 or 0.98 transmission with, is that with masks or is that just in the community that you're finding now?
That is with heterogeneity.
Okay, so that's right. It's within the community. So it's likely the ones without the masks that are kind of commingling and not adhering to protocols, maybe families and somebody was exposed and they're near a family member. So given that it's not as like the businesses that have been essential workers have not been closed down due to widespread spread. I'm going to think of a school similar to an essential worker business like a Lowe's or a Vons, where you have a large number of staff that are working, some of them in close proximity, some of them distanced apart, but all with PPE. Since there hasn't been a huge number of outbreak, would we be in the must category of sending kids home because there was a positive student that tracked into 6 classes, but was wearing a mask and was socially distant? Or would we be in the may, depending upon circumstances that we find after interviewing the classroom or the kids, or leaving it to the parents and their comfort on what they want to do, since their child was with a student that was positive, that had a mask on and was socially distant? So I guess I'm trying to get the musts and the mays. Will we be required to send all of those students home who are, maybe there's going to be 6 or 8 of them that are near that kid, the one kid that was positive, in a roundabout way, if they're in the middle of the classroom? Would we be required to send all of those 8 kids home times 6 classes, or all of those 4 kids home times 6 classes for 14 days because there was a positive student in their classroom?
We would not leave it to the parents. Excuse me. Number one, we wouldn't leave it to the parents.
Okay.
Our nurses have a good amount of experience in determining who a close contact is. You can be a close contact and you can get COVID even with some social distancing and with mask wearing. And it's hoped that our nurses will be consulted, and there have not been reluctant to visit a site. And so it is hoped that they will be able to impart some knowledge to the two local people on your campus, each campus, so that judgment's not totally arbitrary, but based upon some consistency and experience. And so, yes, those people would be sent home. Some people who are identified as close contacts, and some may be exonerated and just not sent home, not tested. It's going to depend.
It's going to depend on the interview.
Yeah, it's going to depend on the situation.
Okay. But it's not going to be a blanket statement that every child that was near this child has to go home and quarantine for 14 days.
I don't think so. No, I can't see that.
Okay. All right. Perfect. I think for the moment that does answer most of my questions. I'll probably have more as you go on, but thank you so much for that.
Sure. Thanks for the questions.
Dr. Levin, I sent out a request in the chat to staff to pass along questions that they had for you. And so I'm going to first start with their questions, if you don't mind, and then I have a few additional questions that I would like to ask. So could you or Mr. Vargas explain, it seemed like Oakview had a higher percentage than the rest of our boundaries. And was that because of a particular outbreak, or is that something that has, our school district goes all the way up to Oakview and touches the border with Ojai. So I was just curious if there was a particular incident that caused those higher numbers, or if that has been a standing trend.
Nothing stands out in my mind. Rigo?
We've had a few, outbreaks that involve long-term care facilities. I can check on to see if that involved, there's several long-term care facilities in the Ventura and Ojai area, and if it happens to be one in that specific zip code, I imagine it does, but I can confirm that. I know some of the rates, though, in your the various zip codes there have been affected by the jail outbreak, as mentioned before, and by the congregate setting outbreaks of some of the long-term care facilities in both, again, there are several of the zip codes, but that specific one in the Oak area there, I would have to follow up.
Okay, great, thank you. Another question was, and Dr. Levin, you addressed this when Dr. Rice and I spoke with you last week, and thank you very much for taking the time for that. Could you talk about the thresholds that specifically, I think for staff, like what, I think you had mentioned to us, 3 kids in a class testing positive would likely kind of raise a flag, or 5% of a population at a school would lead to a likely closure. Are those still numbers that you feel like are sort of representative of your perspective?
Those are the numbers that smart people at the state and I think the CDC have come up with. I think it's 3 kids in a class, 3 classrooms in a school, or 5% in the last 14 days of the faculty and of the staff and the students combined, 5%.
And I assume that like tracking of the 5% over the last 14 days would be done in collaboration with the public health staff that would be our liaisons.
Right. We'll help you. We'll be in contact with you. And I've got to say, at the beginning of this whole thing months ago, we were very rigid and very conservative in our decisions. I think as time has gone on, we've done our best we've become a little more realistic, and we've done our best to accommodate reality, the situations. And we're particularly interested in supporting, being there for public schools. We don't want to do anything dangerous. We don't want to do anything foolhardy, but we're going to work with you to try to keep the schools open if we can do so safely.
And we certainly appreciate that. I had another question from a principal asking about the concern between the convergence of the flu season and COVID. And during our conversation last week, you talked about symptoms and sort of how we would treat a kid who shows up at school with a stuffy nose. Like, what does that look like, given that we are going into the flu season? And then also, I was wondering, are you recommending generally more people get the flu vaccine this year than normally do, or is that not part of our sort of public health push?
That's a big part of it. We really want people to get the flu vaccine this year. We hope that many more than usual get the flu vaccine. Since there's an overlap in symptoms, a major overlap in symptoms between the flu and COVID, it's very helpful to be able to minimize the cases of flu so that there's kind of less wheat to separate from the chaff when it comes to separating COVID from other respiratory illnesses. We also know from a study that was done recently that if you get the flu vaccine and you are in a world where there's COVID around, and you get COVID, those who got the flu vaccine are 10% less likely, almost 10% less likely to wind up in the ICU with their COVID. Those that got the flu vaccine are almost 20% less likely to die or to require intense respiratory support, which I think probably means ventilator. So not having the flu, which is what the flu vaccine is supposed to do, makes your outcome if you get COVID better, more favorable than if you did not have the flu vaccine. So it is an important part of what we're looking at.
Great, and we can definitely help you get that message out to our students and staff, because I think it suits us all. And then the other part of that, so when someone has symptoms, as you said earlier, that would require them to be quarantined and tested, correct?
Well, when someone has like cold symptoms, as you pointed out, there are some people that advocate, some, like I say, smart people who advocate that you go home, because if you're sick, you're not supposed to be at school anyways. Forget COVID, right? So that you go home and that you can come back, if all it is the sniffles, that you can come back after you have not had, if your symptoms have improved and you haven't had a fever without fever medication for 24 hours. So some people will get sniffles and be back at school in a day and a half or two. If it's any worse than that, if there's any question, one would be encouraged to see their doc or their provider for input as to what they think this might be. And oftentimes it's so clear cut that it's something else, such as, so if you had fever and a sore throat and maybe tenderness in the neck, you're going to do a strep throat on that patient and you're going to find strep in all likelihood. And therefore, while it's possible to have both strep and COVID, you've probably got just strep, and that person's going to be treated and get better and come back to school. That person's not going to be isolated or quarantined. Now, the thing that is overriding all of this that has an impact on how aggressively you should approach a person, whether it's a teacher or a student who's got any kind of symptom, stuffiness, whatever, is the availability of testing. There are counties in our state, and we're on calls with these people all the time, where they're still having trouble getting tested in their county. We have a ton of testing in our county. We've got a ton of testing available. So I would encourage almost anybody who gets sick with almost anything to get tested for COVID on your way home. And when it's flu season, there's rapid flu tests around too.
Great, thank you. I had a question from one of our principals about legal ramifications for from answering questions around kids getting sent home and whether they're COVID positive or if a staff member is home because they're sick. And I don't know, you might, or Mr. Vargas might have an opinion about that. We also have legal counsel that we'll be speaking to later, so we'll probably ask them that question as well. But I don't know if you, feel free to weigh in if you'd like.
So explain to me what the legal concern is.
HIPAA concerns regarding sharing health information. If someone, say a staff member, is home as a potential COVID positive case, and then parents start calling to ask why their kid's teacher isn't there, is that sharing of private health information? Or does the public health concern supersede that person's privacy?
Well, we look at it, we come at this from a different direction. When we have a teacher at home who is being looked at for possible COVID, the results are still pending. We don't mention people by name, we deflect. We do our best to not let people know about an infectious disease that we're considering somebody for. In all my years with the health department now, for instance, I can't tell you how many sexually transmitted diseases we diagnose, I think about 2,000 or 2,500 a year in our county, STDs. And I don't ever remember anybody finding out outside of that person that person had that disease. Now, by inference, are people going to think, parents going to think, uh-oh, I think maybe, Mr. Jones is out. Maybe he's got COVID. Well, we can't stop them from thinking that, but we won't contribute to or support that belief.
Thank you. So we had a question about families who cannot afford testing, but you've already answered that because the county test is free. I know there are pay-to-play tests also available, but the county's tests at the fairgrounds are free. For some students, transportation might be an issue. And so certainly as a district, we'll look at how we can support families who need help with transportation, because I'm assuming you don't want someone who's a suspected COVID positive patient riding public transportation.
That's correct.
Okay. One of our principals asks about health offices at the elementary schools and wondering if you suggest preparing a secondary space, because we'll have the typical kid comes in who needs a Band-Aid with a scraped knee or a bloody nose, and we don't probably want that child in the same location as someone who's being sent to the office for potential screening. So do you have thoughts on that?
No. We just remember our hospital personnel, only 3% of them with symptoms tested positive, but that doesn't mean that 3% is something to not pay attention to. I have a feeling that our CD nurses have thought about this and would have some input as to how offices should be arranged to protect people who had, cuts and bruises from those who had coughs and fevers.
Great, thank you. I have another one that says, if it takes 14 days to show symptoms, does it take the same amount of time to test positive after exposure, or will contact tracing and testing of those who have been in contact be immediately accurate, even during the incubation period?
All of these have been good questions, so don't think I don't think that when I say that that's a good question. When it's interesting that when you have the disease itself, you are isolated for 10 days, either 10 days from the onset from the testing, or 10 days from the onset of symptoms. So if you got tested on day 3, now you're isolated only for 7 more days because you've been sick for 3 days already. And we know that we haven't, out of the vast majority of hosts, we've not found live virus in people after 8 to 9 days. Now, the polymerase chain reaction PCR test can be positive for weeks and weeks and weeks after that. And those are just the dead bodies of the organisms there that the test is detecting. And yet the irony is that if you are exposed, you're quarantined not for the 10 days, but for 14 days. So the punishment in some ways is worse. Now, 14 days is because that's the incubation period. Most people get sick on day 6 or 7, 5, 6, 7. Some don't get sick till day 13 or 14. When do you develop a positive viral? When can virus be detected by a PCR, for instance? And that is anytime during that 14 days. So no, a test on day 6 and a test on day 9 does not clear your name. You're 14 days of quarantine.
Okay, thank you. We also had a question from a principal about whether staff should be, and this is in quotation, required to be tested prior to their return.
That's a great question. And I think it'll be, I don't know, I think it's the time of day you asked me that question. I think it would be nice to do that. I don't think it needs to be required, but I think it would be reassuring to do that, reassuring to families, I think, of students. But again, it's not required, and I could see a case made either way for that. I'm sorry for that soft answer.
I can't tell you how valuable this is to all of us. I'm sure you are sensing that there is a great deal of concern among our organization. Obviously, we all care desperately about our children in this community and our colleagues, and we want to make sure that we're making the right decisions to keep people safe. You've done a great job as public health at really guiding our county to make prudent decisions, and we want to continue that path forward as we begin to reopen schools. And so having good information and having good guidance is really important. So thank you.
Madam President.
I did have one other question that was just my question, which was if we return to the purple tier because of an increase in cases, do you envision that there would be a need to impose new protocols on schools in order to remain open?
I just think that we'd come back and say, guys, come on, tighten up. Make sure everybody's doing what they're supposed to be doing. Because if you're doing what you're supposed to be doing, there's really no protocols beyond that.
Okay, thank you.
Madam President, could I clarify the Oakview situation? I do live in Oakview, and I put it on a chat to you, but there was an outbreak, Rigo, so you don't have to look into it. There was an outbreak at a memory care facility here in Oakview that spiked us, and it was not the population at large. And I know that, and it was also confirmed by our principal, Kelsey Sim, at Sunset, that's what we were told. So it wasn't us walking around without masks up here, just so you know.
Good. Thanks for that.
Up there in the Wild West. And then I did have another question from Ms. Moran that was, how will it be mandated or required to report a student or staff positive COVID case to the district if the testing isn't being done on site? And will public health make sure to report these things back to the school site, or will we rely on student or staff to self-report?
Both, which is good. Redundancy is good. But when our public health nurses, and I'll review this with them, when they find a person of school age that is positive, they will follow up and find out what school they're at and make sure to see if the school's open, and they will connect with the COVID people at that school. Also, we can't force people to turn their results in. We hope that people will behave responsibly on behalf of their children and other children. And I think they're going to the vast majority of times. But the receipt of information by our CD nurses is going to be reliable. And the vast majority, I won't say that it's going to be 100%, because it won't be, but it's going to be in the 98th percentile area where we're going to identify that this is a school-age child and make contact with the schools.
Great, thank you. Dr. Rice, did you have other questions?
Yes, I do, a couple. First of all, I want to second what's already been stated. I think it's really important for everybody, not just on the call, but in the community, to appreciate the good work by Ventura County Public Health. I know that Dr. Vargas and Dr. Levin have been working really hard to support schools and kind of balance the advocacy around encouraging schools to open with recognizing the moving parts and the complexities of that we're trying to deal with, and doing a great job of it. And we certainly appreciate all their good work. They've been a valued partner for many years, and I just wanted to publicly acknowledge them and thank them for their efforts. In addition, I want to turn my attention to testing and just share that in a recent update I put out, I had stated that we had learned recently that there was sufficient capacity in the county to allow school districts to send all of their teachers to like the fairgrounds, for example. That had previously been mentioned according to a conversation I had with Rigo and Dr. Levin and Mike Powers many times before that. Perhaps that was my oversight, and I've apologized to them for that oversight and for communicating that. But that being said, it was also shared, I believe yesterday, Dr. Levin, that the state guidance before, and I think some of the districts were working under the premise that we would have been required to test 25% of our employees, not just the teachers, but like the custodians and the cafeteria workers and so on, once every 2 weeks, essentially 25% of your employees every 2 months. So
every 2 weeks. But yes.
Every 2 weeks. Okay. Can you speak to clarifying that in fact is no longer the requirement, and that we kind of are now, at least for now, on our own to kind of work with you to develop a recommended protocol to replace that? And then maybe it would be great to hear your recommendations about what that might look like, using best practice or a way that we could instill confidence in our teachers and in our community, given that prior guidance is no longer the case.
Yeah, it's not rock solid that the guidance is no longer the case, but it was really seriously being questioned in the last couple of days. And from the person who's in the position to make the final decision, she said to me in an email that she's really leaning towards not mentioning anything about required testing at all in the final guidance that comes down. And the hierarchy at the state is like any hierarchy. And she's said things before that had the understanding of other health officers in the state, all the county health officers. And then it gets on up to the Mark Ghali, Dr. Ghali, or to the governor, and it changes. So we can't be sure till we see it in writing. But yes, what you say is correct. It looks like we're heading away from the quarter of the staff being tested every 2 weeks. And it looks very likely like that's going to be the case. So what does that leave us with? The health officers, all 58 or so of them in the state, were left with coming up with ideas about what they think should be done. I'm sure some of them have emailed the state health officer about this. I'm sure that we'll be talking about it in the next few days. Maybe there'll be some really brilliant ideas and simple ideas, elegant ideas that come out of that. An idea I have is not very elegant. It's just really what we do for the population in general. And that is when we come to know about a case in a student or a staff member, or when we hear a rumor about a case in a student or a staff member and we can follow up on it, that you proceed with the same kind of testing that we just talked about already, where you look at who that person was exposed to and you consider testing those people around that person. And they're home waiting for the results of the test. And would they be quarantined or not? Again, there's that judgment issue. Many of those people probably of the closest contacts would be quarantined, but some might not be based on judgment. And that just takes a whole different, that takes the usual approach and applies it to schools. I don't know if parents will be reassured by that or not, but the greater county is pretty much reassured by that approach.
Okay, and then if I heard you correctly earlier, maybe having folks tested before we come back to in person to add that extra layer of confidence in the public and in the
yeah. I certainly think that's a reasonable thing to do.
Okay.
That's not a crazy thing to do by any means. It's very reasonable.
Okay, thank you. Another one I wanted to clarify, there was a question that came up earlier about the availability of space for to serve as places to evaluate students or to have students wait while they have other kids who just have a bloody nose or a scraped knee or whatever. We will cover that later, but I wanted to assure the principals, Eric Reynolds and I have talked about that, and we are in the process of trying to see if we can make that happen. So that's been being looked at and being worked on for a week or so now. So I just wanted to share that with the principals. And then finally, I wanted to talk about the issue of the reality of safety versus the perception of safety, because those two things are extremely important. And I think the example I shared the other day with the other superintendents was that if you have a situation where the public health says it's safe to open up businesses, but the public doesn't think it's safe, then you have restaurants sitting there open with nobody going to the restaurants because they don't think it's safe. I'm sharing that analogy because we're in the process of, surveying our students, our families, and our teachers to determine the degree to which they feel comfortable coming back to work or coming back to live in-person instruction, because we don't want to have, half our teachers saying they don't feel safe, or half our students feeling not safe, or having a mismatch between those two critical populations. That's a huge task that cannot be overstated in terms of its importance. And I wanted to share with you, you probably have heard this narrative, and some would not call it a narrative, some would call it a reality, that schools in the past tend to traditionally be vectors of infection. We know that kids go there and, the flu and the cold and all of that tend to spread. And in addition to that, some of the feedback I've been getting from teachers revolves around that narrative and is built upon by the anecdotal, though it may be, frequent articles coming out about schools opening up and then closing right back down because the numbers went up. So I think it would be short-sighted of me to let that elephant in the room that is being so commonly asked of me by our teachers and support staff to go unasked. And I'm just wondering if you have some wisdom for us that we could respond to folks who are picking up those newspaper articles or watching the news about this district in this place or that place who opened up and then shut back down after 2 or 3 weeks.
I find it intimidating anytime anybody asks me for wisdom, because it puts whatever you're going to say next on a higher plane. So the thing that comes to mind is analogous, and it involves people. And that is when somebody gets, pick a disease, somebody gets breast cancer, okay? That's a bad disease. And somebody hears that somebody else who got breast cancer died, and they panic because they know they're going to die. Well, the truth of the matter is, like 96 or 98% of people, I don't know if that number is correct, but I wouldn't be surprised if it is, who get breast cancer don't die. So one person's disease course does not mean that another person will have the same disease course. And in some ways, I find that analogous, that there can be a problem in one school or one classroom, but it doesn't mean that you're going to have that problem or have the same outcome if you have the beginnings of that problem in your classroom. So there's always going to be information like that, which is intimidating. And you began with talking about the importance of public confidence in something that you do. And there's an interplay between that public confidence and the belief that either you're going to open and close, or we're going to do good. We're going to succeed here. So I don't think the fact that there's that bad experience out there with that classroom or that school should make us think that, no, we're going to do a good job. We're not going to let that happen here, and that approach won't be a success.
Thank you so much for that answer and for being here today. I appreciate you and Rigo spending so much time with us.
And unfortunately, I've had 2 new questions pop into the chat. So I promise I'm cutting it off after this, Dr. Levin. So okay. Again, I really do appreciate your time, and I know our staff does as well.
Sure. We're happy to be here.
So we received a question asking, is there likely to be any softening of the 6-foot social distancing rule if we were to enter yellow or orange phase, or do you envision that remaining for a longer period of time? And it was asked by someone who works in our secondary program. So as you can imagine, high school and middle schools, where our classroom sizes are much larger in terms of number of students, that social distancing requirement is really difficult.
That's not going to change. When it will change is when most of us have had the COVID immunization.
Okay, thank you. And then one last question. You mentioned earlier air ventilation and its importance in classroom. Could you talk a little bit more specifically about what that looks like, or kind of how that impacts virus transmission?
Well, again, I'm going to give you an analogy. That 2 analogies. One is, we know that it's safer outdoors. There's less transmission of the disease outdoors than there is indoors. And a recent article in New England Journal of Medicine found that it was 1/18 as much transmission outdoors as indoors. That doesn't mean that you can't do risky things outdoors, or that being outdoors takes away all the risk, but it's a lot less risky to be outdoors. So to the degree that you can simulate outdoors indoors by having airflow, because really what is outdoors all about, you protect yourselves that much more by doing it. So the other analogy I was going to make was, again, with tuberculosis, and that is, buildings have to have and many of you probably know this already, just from the school setting, have to have a system, an air system that has a certain number of air turnovers per hour. I think it's a minimum of 6 for most public places. There has to be 6 complete air turnovers per hour. Where did that come from? Well, it came from tuberculosis, and that is in buildings that have that much air turnover per hour, there is much less likely a transmission of tuberculosis if someone has tuberculosis in that room. That's the break point. And there's not a whole lot of reason to think it's different with COVID. So that's airflow. The more airflow, the better.
Great. Thank you very much. And as promised, that was our last question.
Madam President, I have one comment. I just wanted to say to Dr. Levin again, thank you. But earlier on, you said something about unions being problematic, and we are very blessed in Ventura Unified that both of our union associations are very cooperative. They've been on every special meeting we've had. They've
Great.
been part of the problem, not part of the solution, not the problem. So I just want to let you know that we're blessed more than most government entities, and that we have a great working rapport with our associations.
That's great to hear. It really is great to hear. It's wonderful.
And then I just wanted to ask for Mr. Rodriguez, I know that you have public health nurses and staff who are available to do presentations for staff and family members who have questions about the safety of reopening schools. And I just wanted to give you an opportunity to share the information about that.
Yeah, and that's case by case. Is certainly an open invitation to anybody in terms of PTAs, principals, teachers. Some of these question and answer sessions have been requested by superintendents, others from parents, and so on. And so we do have that as a resource, but we do want to coordinate with you so that you as principals and school board and superintendents are aware. Sometimes, again, these requests are coming in from different entities within the group, or different groups within the school districts. But it is a resource, and I think for the most part, the feedback that I've gotten, and I'm happy to entertain any feedback that you may have of what you've heard in terms of some of these sessions. We have our team working with us with Dr. Levin. At times they may share something that hasn't been fully vetted through us, and as you just even heard from Dr. Levin and I mean, we're trying to do our best without concrete things that are coming down from the state and from others, and it's evolving and changing. And some things we're treading on, leaving it up to definitely your purview in terms of the school districts making certain decisions, and maybe even being more strict, say, on testing requirements than we would formally come out with a requirement. So a lot of moving parts. All our intention is to be as a resource, whether myself, Dr. Levin, and our dedicated team of nurses, again, to provide these sessions, just so they can help us out as we wouldn't be able to meet all the requests. But it's case by case, and it's on request.
Great, thank you. So I think our understanding is that if a family or PTA or staff organization is interested in one of those presentations, they should reach out to their school principal, and the school principal can reach out to public health to schedule that presentation. It's a great resource for families to have an opportunity to ask their questions and to get a solid answer from our colleagues at public health. So thank you both so much for being here. I know we've taken a lot of your time, but we really appreciate you and all the work that you've been doing tirelessly since January. And so again, thanks so much for your collaboration.
You're all very welcome. We're in this together, and I know it's continues to evolve and move in situations, and we've not been able to answer all the questions clearly, but I mean, we are having other meetings with at different levels, with the superintendents of Ventura County Office of Ed. We're developing a Q&A document to then be able to share. I'm sure Dr. Rice will then share it back with you guys as we develop that early draft. There's going to be other materials that our team is reviewing. It should be like a workflow kind of a scenario to help further guide you in your decision making and your staff. So there's still more to come, and if you continue to have questions or a need for us to try to join you at another similar meeting as this, please reach out to us, and we can continue definitely to work with you since it's a team effort. So we really appreciate the invitation. So yeah, thank you again.
And thanks from me for the opportunity to be able to speak with you and to kind of get on the same page with all of this stuff. And Rigo and I appreciate, the recognition of how hard things that, people saying we wouldn't want to be you, but every time people say that, we look back at those people and say, we wouldn't want to be them. You guys are going through a lot, and we appreciate that.
Well, thank you very much. And with that, Dr. Rice, would you like to continue with your presentation?
We're going to log off.
Okay, bye-bye.
Thank you. Okay. Hopefully you had a chance to look at this slide. I purposely put it up there when Rigo was talking about this so that you could all see it. It'll be available, and we'll send a link out to the PowerPoint this afternoon following the meeting so that you have availability of this to use in your communities and with your staffs. All right. So I want to find where we were. I think I had just finished this slide talking about the topics that I would be ready to, or that we would be ready to share with the board today. And so in terms of logistics, let's try to zip through this. We've been here 2 hours, and I know the board has lots of questions for the staff, and so we want to make time for that. But we no longer have a waiver required. We're in the red tier. We won't be required, as Dr. Levin confirmed, to reclose schools if the county goes back into the purple, absent specific outcome measures at the sites. It's not automatic. We obviously have been in consultation with our employee unions. We will continue to be in consultation with them as things move forward. In the past, we've developed MOUs and joint understandings and joint statements. That goes without saying that will continue. And we will need to have a detailed plan to address all the following items that I'm going to cover in the presentation today. So the first thing I wanted to do was to talk about the importance of the community surveys as a very important benchmark in our ability to make progress. The reason that I asked Dr. Levin the question about the issue of confidence in the safety versus the reality of the safety is because the board has made a commitment ever since July to honor both student and family requests to remain on distance learning only in the event that they had immunocompromised folks in the household, be it the student or a family member, and also asked us to work with our employee bargaining unit to honor teacher requests to the degree that we can. Without either of those two commitments, I would tell you that the logistics would be a whole lot easier and a whole lot faster. That does not mean that those logistics would result, that would be a better outcome. Far from it. I completely support the board's wisdom in committing to honoring those choices made by our families and also to the degree we can of our teachers. And so what we have done is to try to get us in the ballpark for determining the conditions under which families would send their students back, and also surveying our teachers to find out how many would likely prefer in-person versus how many would likely prefer distance only. So I'm going to walk through some of those findings, and this is a very important first step to returning to in-person instruction, honoring those commitments that the board made in July. So what you can see here is this is one of the key questions is talking about, it says I would send my student back as long as state and local health guidance is followed. You can see here that about 60% agreed or agreed strongly. And so that's positive. We have a majority of families who feel ready to send their kids back as long as we have a good safety plan. That's not to discount the 29% on the other end, and I'm going to talk about that. But in terms of our ability to return to in-person instruction, and when I say in-person instruction, I'm talking about the hybrid model or some variation of that hybrid model that was approved in July. Just wanted to make that clear. It's encouraging that 60% of our families are open to that idea and another 11% uncertain. So it
Dr.
could,
Rice, I'm going to interrupt you just very quickly. I think that the answers that you have there, and I want to make it clear and transparent to the board and the public, are the ones for our TK through 5th grade. However, the numbers are almost identical, and I'll make sure that the final numbers that go out in today's presentation do reflect the entire survey. That is my fault, and I apologize, but I will ensure that the final numbers for everyone are in there. And if for some reason when you go to another slide, they are different for the full family survey, I'll let you know. But for the most part, they were almost identical. The percentages are just a little off.
yeah, thank you for saying that. And no need to apologize. That is intentional. I'm going to talk later about why I'm not showing the secondary numbers. I appreciate you recognizing that the secondary, the grades 6 through 12 numbers are almost identical to this. But part of the reason that I'm sharing the TK through or the preschool through 5 numbers is because that is the area where the logistics and variables can be a lot easier controlled than the secondary. We talked about that. We've talked about that many times, and I have some very strong thoughts about the ability of us to honor in-person instruction in the secondary programs, given the multiple cohorts that are required, and given the potential spread that board member Moran alluded to when she asked the question about moving from class to class, and then also the disruption to credit-bearing classes and grading. And there's just a lot of reasons that secondary is a lot more complex with a lot more moving parts than elementary. So we'll talk about that in a little bit, but thank you so much for pointing that out, Marianne. Okay, so that's the first question. The second one is, if I send my student to in-person teaching, I will be requesting transportation. This is also a positive because there's a very small number, only about 8%, 8.5% to the potential of 15% at the most, if you include the uncertains, that would be likely using transportation. If you recall in our conversations earlier this summer, that was a significant hurdle that would severely limit our ability to serve secondary programs and elementary school programs, given the number of buses, number of drivers, and requirement for social distancing.
Dr. Rice, I was just going to ask, given that we had 2,900 responses from our elementary school families, and we have I'm guessing about 8,000 students, do you feel that result might be different if we had more response from some of our schools that rely more heavily on busing?
I do think the numbers could change. I think the sample size is large enough to get a pretty clear picture, but your point is valid. And prior to us going back, that would be one of the next steps. And that's on a slide later, is to say that like the choice that our parents would be asked to make relative to returning to in-person or staying on distance learning, we would have to have binding choices, as much as that can be done, for our folks to say, are you going to ride on the bus or not? That would have to be much more precise. But nevertheless, I do want to point out it's a positive because it frees up, it increases our flexibility to serve our community when fewer people are electing to ride the buses. Okay, so what are some of the challenges? Well, so this question is asking about having someone with serious underlying health concerns, and there were about a third of our families who indicated that they either strongly agreed with that statement or somewhat agreed to that statement. And to the degree we have a responsibility to the community to not, to not spread the virus into those families, and you take that responsibility seriously, then this is a point to consider. The next question is, to what degree do our families support the board's decision to remain in distance learning only for the fall semester, regardless of any of the prior questions? The board has, it's interesting that the board has solid support. A majority of families support that decision by about 54%, with 8% undecided. So if you take the two on the left and compare them to the two on the right, it's 54 agree with your decision or strongly agree versus 37 that either disagree or strongly disagree. And that is, that's encouraging, but if you compare that to the percentages of folks that would likely send their kids back if we follow the safety protocols, that still remains at 60%. So I think what that means is people are basically saying they support your decision, but if you do decide to go back, about 60% would still go back. So I just wanted to point that out. And then this is an important question that we ask because, and I'll get into the details of this later so our families can understand this more deeply, and our teachers as well. And that is that to the degree we honor students' ability to stay on distance only learning and teachers to request distance only assignments, and we honor those requests, it is very likely that there will be teaching changes. I don't see any way around that. And I'll explain to you why I think that is later. So we asked folks, would you still send your kid back if you knew that your teacher might change? And then the number goes down to about 36% from a much higher number earlier. So I take that as a sign that our families like our teachers. They have good relationships with their teachers. They would prefer not to change their teachers. And yet that's going to be a reality if we return to in-person and honor the ability to stay on distance learning only. This next question is asking about if the district returned to in-person instruction, I would choose to have my kid on distance learning only. And that is right now sitting at about 35%. That's challenging because that's a fairly large number if it materializes. And if we are serious about honoring that, then that means we have to have a way to staff distance only classes for about 35% of our students. And I have some math and some models for staffing that I'll show you in a later slide. But it's not to say it can't be done. It just means that it's going to be a challenge and require some disruption. So on our staff survey, we had a relatively small number of teachers indicating that they must remain on distance learning only, about 12%. And in my analysis of those who indicated, and again, I'll show these numbers later, the number of teachers who would want to remain on distance learning versus the number of students who would remain on distance learning, we feel like we can probably accommodate such teacher requests. That's actually positive. In early discussions with our teachers union leadership, they were strong advocates for us doing so if we could. They recognize, I think, that logistically it might not be possible, but would go a long way towards serving our students who wanted to remain on distance learning, and also making sure that we're taking care of our teachers who need to be on distance learning only for health reasons and so on. I think we would be able to do that given the numbers we have from the survey. and that's very positive. So a majority of teachers indicates they have no special circumstance, and they prefer to return to in-person instruction. And there's a lot of caveats to all of that. And at some point in the discussion, I'm sure Dan can jump in and share some feedback about just some nuances around those dynamics. So also a few challenging things is we do need to work on the staffing. I reported earlier that I think it's doable. And I'll talk a little bit about what that might look like, but it certainly is not going to be an easy thing, and it certainly is not going to happen quickly. And working through the impacts on employees with our VUEA and VESPA leadership. And that has to do with things like not just the teacher assignments, but will support staff need to have their assignments adjusted to go along with those teaching assignments. How will we work with testing? That goes to the issue I was asking Dr. Levin about, given the recent apparent changes. And that was as late as yesterday. I have consistently shared my concern that testing was an important issue, that before we opened, we needed to have all those logistics worked out. And then to hear yesterday that the kind of the certainty was not so much anymore was obviously not expected by any of the superintendents. And I think you heard Dr. Levin allude to the fact that it wasn't fully anticipated by him. So I know VCPH is working hard to help us through that. We heard what his recommendations are, but given that just changed yesterday and we heard what his recommendations were for potentially moving forward, we're going to need a little time to put that into practice before we would open up to in-person. This is the very simple staff survey that we put out, asking them if they had a special circumstance. And then I'm going to move my bar over here that's blocking my slide to the other side. There we go. And the second slide is asking for responses to do they have a special circumstance, and if so, would they prefer to stay on distance learning? Do they have to stay on distance learning? Or do they prefer to return to in-person instruction? I'm encouraged by the fact that 54% are ready to say they would prefer to go back to in-person instruction. But what I would share with you from my conversations with teachers and with teacher leadership is I think a lot of that's probably driven by just missing kids. Our teachers are great. They love their kids and they have close relationships with their kids, and it hurts them to not be in the same room. I also think some of it has to do with the stress and anxiety of learning a whole new system of delivery and dealing with the long hours and workload and stress of making that adjustment and keeping it up for such a prolonged period of time. And I think probably Dan would second that. It's hard, and going back to what they know and love best is certainly preferable for a lot of our teachers if we can make that a doable thing. So preparations and progress on logistics. We haven't been, stalling or waiting around or whatever. We have been working behind the scenes to get ready, knowing that this day was coming. I want to applaud Eric Reynolds and Bill Elsenbaumer and his team of folks for the work they've been doing behind the scenes to mock up some rooms that would show the board and the community what their classrooms would likely look like so they can have a visual for that. And I also want to thank Mike Askey, principal out at Juana Maria, for making some of his rooms available. And at this point, I'm going to briefly describe what the rooms look like, and then I'm going to ask Bill and Eric Reynolds to jump in and add anything that I miss. But this classroom here is an example of a room where you can see all of the furniture. Student desks have been left in the room with the blue X's marking where folks aren't supposed to sit. You can see there are no chairs at the desks where the blue X's are. If you're wondering why we would do that, it's because one, the physical distancing is reinforced by the physical presence of the other desks. And two, it eliminates storage issues. It takes time, energy, and space to store all that stuff away. And then when we need it back, to unstore it and put it back. So that's the reason for that model. Example 2 is the example with the extra furniture removed. You can't see it here, but I believe a lot of the extra stuff is in the back of this particular room. And the physical space is simply managed by the offsetting of the desks. This is also an example of an option for a teacher workstation. And I say option because not all teachers will want this, but this is a plexiglass station with that essentially functions as a call-up station where a teacher can call a student up to have an individual conversation, to turn in a paper, to do a little bit of quick tutorial. There is an underpass underneath the plexiglass where they can pass papers back and forth if they need to. And we certainly would get those in place for any teacher who would want them. And so before I move on to this, Bill or Eric, would you like to add anything about the classroom setups that we've been working on?
Yes, Dr. Rice, thank you. So one of the issues we're going to run into is there's a lot of furniture in classrooms that isn't school furniture. There's some old wooden furniture and things of that nature that get brought to classrooms that we'd really appreciate if people could take home, that help us a lot. And we do have our stages in our cafeterias, and that's where we plan on storing all the furniture. We can label it and hopefully get everything back correctly when things turn to each classroom. So I think you covered it very well. So thank you for that.
Okay, Eric?
I think just the one point I wanted to mention briefly, in addition to helping with the potential storage issue, one thing I think might be a nice option if we kept the extra desk next to the desk the student would ultimately be using, is it creates that natural buffer for that 6 feet space. So I think that might help some staff with that social distancing aspect if we were to go like that. But I think probably those two different options in the general education classroom could almost be a teacher choice.
Okay, thank you. And Eric, I'm going to run through, this is information that Eric and Bill graciously provided to me, outlining some of the areas that we've completed, including setting up 3 different sample classrooms, obtaining and delivering PPE, personal protective equipment, that includes like masks and hand sanitizer and those kinds of things, to the sites. You can see the list of items there, including thermometers, hand sanitizer, foggers. I was asked a question, Eric and Bill, by one of the board members about exactly how many of those so-called foggers, which are meant to clean the classrooms by spraying that fine mist around the room and it dries pretty quickly. How many of those do we have? How have they been deployed? And what's your thought about their use?
I'll take this one, Dr. Rice. We have 5 for every high school, 2 at every elementary school. And all the custodians have been trained on how to use them and are using them currently in the offices and classrooms that are being used. So we're getting used to using them. They're just secondary cleaning. They go after all the deep cleaning that happens, the high touch surface area cleaning. Then we come in and we fog.
Okay. And what I would share with the board and also with Bill is that in my conversation with Mr. Nelson from VUEA, I think that the cleanliness, and I'm looking over at Ms. Chandler right now since she gets the honor of overseeing the folks in that department now. The cleanliness of the rooms and the rigor with which those rooms are cleaned is a huge issue for them, rightfully so. They want to feel secure in the fact that that's getting done. I have some ideas I can share about the monitoring of all issues related to COVID safety and security, but specific to the room cleaning, can you, in addition to the method that they're cleaned using the foggers and so on, can you address anything about the way we keep track of, like, is there a public record they can look at to make sure their room got cleaned? Like, is there a cleaning log? Is there anything we can do from your perspective to boost that confidence in our teachers that their rooms are safe and clean when they show up to work on the days they do?
Yes, we have created a cleaning log that could be mounted on the wall inside the room. That would be a checklist that could be checked off nightly by the custodial crew. That was the ideal that we'd come up with.
Okay. I also, okay, yeah, Eric.
Dr. Rice, if now would be an appropriate time, could I just make a comment on the PPE that's listed on this slide?
Go ahead.
Thank you. So I just wanted to point out to everybody that all of these items have been received and distributed to sites. So they are there, they are ready to go. We have more available if sites need more. We're getting a couple additional items today from Ventura County Office of Ed. Those will also be distributed to sites. I've sent out summaries of what has been sent out and what is available, but it's my intention in the next short time period to send out another summary to principals and office managers, so when they need something, they know how to get it.
Okay. Jerry, did you have a question? Dr.
Yeah,
Jennifer?
I did. We're not asking our teachers to do any cleaning, are we?
I'll take that, and Bill can jump in if he wants. The expectation is that high touch surfaces and all the surfaces that have always been cleaned by custodial will continue to be cleaned by custodial. One of the things that's not on this slide, I don't know if it's on another slide that Dr. Rice has, is that in addition to hand sanitizer stations being installed in every classroom, we also have ordered bottles of our district disinfectant and paper towels for every classroom. We're not expecting teachers to clean, but if a teacher wants to go above and beyond what is done at custodial, particularly for their own desks, for their own laptop, those type of things, that disinfectant and paper towels will be available to them should they want to use it.
That covers it, Eric. That's it.
Thank you.
Thank you, Eric. I had listed down on this. It was on the next slide, so I advanced the slide, and I think you're talking about the couple of the items there in the minute.
I have a clarifying Mr. question. In the CTE classrooms where they're using tools and appliances and different things, does the Mr. actually protect that or do you have to pick up each tool and each thing and clean each one, or have we figured that out yet?
Yes, Trustee Lomax, what they do, the way these foggers work, it's such a fine mist, it surrounds whatever surface is out that it mists over. So you don't have to move things around and detail every object in the room. It basically just mists a fog over it, and it clings to all those surfaces.
Okay, thank you.
Okay, moving on. We do have a few items.
I had a question from the chat. Will we at some point post the content or ingredients of the material that's in the fogger for parents or staff who have questions about that?
We certainly can do that. We did a lot of research into what went into the purchase and selection of that product. So yeah, we can do that. That's not a problem.
Okay, and Eric, you guys are still on, so if you can jump in and help me on this. But in the assessment of where we are in preparing for in-person instruction, there are still a few things that we're working to make progress on. One is that any classroom that's used in hybrid will need to have the furniture rearranged, and some of it has to be stored. We talked a little bit about that. And if they have personal furniture in there, we'd like them to remove that. I think Bill mentioned that. We still have a few hand sanitation stations that Bill shared with us we were waiting on, right? We're just a few.
Yes, and they arrived today. They will be going in this afternoon and next week. Those will be done.
Okay, excellent. And then we're working with health services to finish obtaining that other shipment of PPE that Eric already talked about. The blue tape we have on order to mark off in case teachers want to use the model that we shared with you where the furniture was left in the room. And Eric already mentioned the last one there, that VCOE talked to us about getting a new shipment. Anything on this slide you want to touch on, Eric or Bill? The temperature scanner at the ESC that's been in process for quite a long time now. Plastic screens, as I mentioned earlier, can be installed upon request, but they're not required or not envisioned on MOS, but maybe just in, like, if a kindergarten teacher has a stations place where the
Do we lose Dr. Rice?
Yeah.
Frozen.
Well, I have a question, so maybe it's for Eric while we get Roger back. In our meeting with Dr. Levin last week, we asked him about whether he felt like temperature screening for students was relevant or helpful, given that the medical community seems to not view temperature as a strong indicator for young people. And so I saw the temperature scanner on that. That would be used for staff and visitors, or are we envisioning using it sort of more broadly?
Well, actually, the one slide Dr. Rice just had up was perfect place to discuss that. So it's good timing for your question. We need to have further discussions on what type of screening we're going to do. Active screening is currently not required except in situations where maybe you have an outbreak in a room, and it would only be required for that specific group. Temperature scanners can be used in a passive or an active screening. And you're right, the same information that you just said. I've watched medical webinars in that, as many as 40 or 50% of people with COVID do not have a fever, and it's even higher in the younger folks. So that's only one element of screening. And we also have our questionnaire, of course, as well. Our current practice at our sites is passive screening. All employees are supposed to self-screen at home, and we have the temperature scanner or thermometers at a site available if an employee either doesn't have a thermometer at home or forgot or wasn't able to take their temperature before coming to work. So those are some additional conversations that we're going to need to have. If we do active screening, there's some additional things that need to go along with that. We need to develop some policies and some training where there's some privacy issues. None of this is certainly insurmountable, but there are some additional steps that we need to take.
And I will chime in on one
but
more.
I see that we have Dr. Rice back. Roger, hopefully you heard that question.
Bill had something to offer.
Well, I was going to bring up one more subject. If the teachers are going to want screens at their desk for that separation in every room, we will need an accurate list. We have a commitment from a company that can get them to us fast. That's one of our biggest struggles through this whole event is trying to get material that's promised to us. And so we've got a commitment. We're going to get it in writing that we can get them in 2 weeks. I'll just need an accurate count of how many, and we can make that happen.
And we can work on that, Bill. But yes, Sabrina, to speak to the question that you brought up and what Eric was mentioning, we do need to decide if we want to do active or passive screening. So that is something else that we should discuss.
Okay, great, thank you. And there's a question that I received in the chat that asks if we are having students wearing washable masks, will there be an expectation on families for them to clean them, or what are we giving guidance to families with regard to student masks, the type and regular, changing or cleaning of them?
I can jump in. We haven't really discussed that in meetings that I've attended so far, but I'm certain that when we go back, Marie Ann will be sending all sorts of information to our students and working with health services on not just that issue, but hygiene, all sorts of issues related to that. And I'm sure that that would be sent out in our normal notification processes.
And I see Marianne has her hand up.
So I'm already working on some of these templates that will be going out to the various directors to get them to change any content that are in them. We're also going to be doing various videos. We're going to be working with CAPS Media so that they can visually see how some of these rooms might look as they're coming on, what types of testing or protocols will be in place before they get on a bus, what recess might look like. So we have plenty of things in the works. Once everything is determined exactly what it is we're doing, we will jump in and start getting those things done. Our high school mascots, I'm already making masks for them so that they can be the stars of the show when we do our videos. So we're getting all ready.
We'll have something about tucking your nose in so that we don't have all the little...
Yes, and actually the handout that I did yesterday for masks that I haven't even had a chance to send to Eric, he doesn't even know it's ready, so I'll send it to you in a moment, does also incorporate what type of mask we're requesting that they use, that they wash any cloth masks daily, that they actually send a backup mask in case something is to happen to the mask that they have, etc. So all of that is currently being worked on behind the scenes, and the directors will be the ones to correct any language in there, make sure it's up to date, and then we'll send those out as we get closer.
And I just wanted to point out to President Rodriguez that when that PPE was listed within those masks, we have extra masks that have been delivered to sites, both disposable and reusable masks that are intended and sized for students. So if a student is to come to school and they forget their mask, because I know I've forgot my mask many times as I've gone to Trader Joe's or wherever, we will have a mask there that they can take with them.
Great, thank you. And I apologize, Dr. Rice, you were on like page 3 of our participants for me now. So now I see you're back.
Can I ask a quick question about masks before we get off the subject? I appreciate that we're going to have extra masks, and I think that's important, but having done safety glasses for robotics for years, then the teams kind of expect that you have it, and they honestly show up without them, number one. So that could be a huge, huge expense that we have to think about fiscally. And the other thing is that will the bus drivers have masks? So if a child shows up to a bus stop without a mask, the bus driver would give the child a mask.
Certainly, we can provide the bus drivers with extra masks. That's not a problem. Like I said, we do have supplies. I understand what you're saying, Trustee Lomax. And we definitely will be asking parents to provide students with their own masks. But again, we'll have a supply if they don't have one or if they forget.
And along those lines, sorry, Dr. Rice, it's almost like every class needs to have a box of them. I think most boxes are 50 to 100 masks, but I know that's a daunting task and a lot of funds, but it may be something we look forward to now and then not having enough masks for the whole future.
Thank you for that. First, I apologize. I got the boot. For something happened. I got kicked off and disconnected, whatever. It happens, right? The last bullet on this slide, and then we'll move on, is alluding to what we talked about earlier. Eric was terming them alternative healthcare rooms where we could have a place in case students are sick if we need to keep them isolated from students who just have more like a skinned knee or something like that. So Obviously, we are going to need to now reassess our employee testing protocols and how that looks. We also are looking at using our CARES money at a budget meeting with Ms. Chandler and Ms. Campbell. We have CARES money to support some of the processes and protocols that I think are going to be time intensive and labor intensive that would be beyond the scope of people's current responsibilities. One is a testing support manager. So if we are going to have testing going on regularly, someone has to not only inform people who's supposed to go get tested, but also collecting results and storing results and following up with our liaison people and so on. I have early indications that one of our retirees who works with us regularly would may be willing to do that on an hourly basis. So that's kind of what that would look like. But I'm happy that that there's some willingness there. And then also, one of the things that we've learned even through distance learning is that there sometimes can be inconsistencies or concerns raised at the sites relative to mask wearing or physical distancing or things like that that are really important to build confidence in our workforce that that are better handled by someone other than the principal. I'll just put it that way. And our thought initially is to have another one of our retirees who works with our principal coaches right now be kind of a safety implementation manager who could work with Eric Reynolds to just respond to concerns and take the load off our principals and Eric on just issues like those people over there aren't wearing their masks, and I was on the bus today and nobody had a bus, and just track down and run down some of those issues as they arise that are more kind of routine in nature, and just to build confidence that we have the resources available to address the concerns from teachers. And I think that would be a worthy small investment of our CARES money to instill the confidence that we're taking care of issues as they result on the school sites. So what progress have we made on our small cohorts? Right now, we have our 3 comprehensive high schools working with small cohorts of students in person at Buena, Ventura, and Foothill. I don't know if there are more teams, Ms. Lomax, but I know there's a robotics group out at Cabrillo working. And then the music program for strings and percussion only. As I said, I think we have initial interest at Ventura and Cabrillo. I believe that Dr. Bayless may have a meeting with some of those folks later today if he hasn't already done so. And then in the planning stages would be, hopefully there's, and I said this already, there's very strong support for the small cohorts. I think it was 75% and up of our respondents said that they would like to see that implemented. So we're looking at building our small cohort support, specialized services in the areas listed there. And that should be shortly, regardless of what direction you choose for returning to in-person instruction. Those items under letter D would start as soon as we possibly can. Velma?
Question on music and robotics, all the exceptions that we're making, are those just at the middle schools or are those at the high schools as well?
High school as well. So
whoever, I know that the robotics class started at Cabrillo because at that time we had to get a special exception, but now it would go to also the high school as well, right? And the same with music and other CTE courses.
Yeah, but yeah, they're not automatic, right? So there's a process they have to go through, and typically we have them working through Dr. Bayless if they're high school and Eric Reynolds too.
Oh, yeah, no, I'm sure they have to have a plan and everything.
Yeah.
And then one of the things is that I was asked by a CTE teacher if they need some information so that they know what they have to do to get their classes prepped. Are we going to be disseminating this information to the teachers so that they know what they have to do when that time comes, or if they want to ask for the exception to do small cohorts now?
Yeah, so the way that I would envision that, Velma, is pending your guidance today, because that's, you're the elected representatives of your communities, and we want to move forward with the guidance you give us today and Tuesday. But as long as there's approval for that, the way that I would envision that would be our team would get together and put together a kind of, for lack of a better term, like an RFP, where a posting that would go out to teachers to say, are you interested in doing small cohorts? Here's what we're offering by way of compensation, supply budget supports. These are the areas that are allowed. And then let teachers express an interest and go ahead and implement as many as we can. So far, I think the reason we've been successful is because we've gone slow. We have enforced the safety plans, made them develop, and then checked in on them. And we've gone with the coalition of the willing. We haven't forced people to do things that they're not comfortable with doing. And that is key at the first stages of the process.
And I appreciate your answers. I also want to make sure that we're very clear that any exceptions we're making right now, and I could be wrong on this, and maybe you're looking for direction, is for courses, classes that get credit, not for clubs, because there is a big difference.
Yeah, so I would say I don't think of it as either of those. I think of this as special guidance that was afforded to us by the state and by the local health authorities that said, look, we know you guys are in distance learning, we know you're in the purple tier, but we want you to start engaging with kids in person to the degree you can. And so therefore, here's this special dispensation to allow folks in athletics to get together in these really small groups to just get, strength training and conditioning and skills building in stable cohorts. And then following that, I followed up and asked the local health department if robotics could be seen as a corollary of the athletics, given the same exact parameters. We got permission to do that. Following the successful implementation of that, I reached out to Ventura County Public Health and asked them, I know that the state guidance says no music because of the spread of droplets, but what if we said just percussion and strings? Would you be open to that? And they said yes. So it's been, there hasn't been any blanket approval except for athletics at the state level. It's been incremental in nature. And I feel like that's going to have to continue.
And I just want you to know that everyone appreciates your work and the work of staff, because we do take all this seriously for our students, and we're trying to do the best, but keep everyone safe. And it's it's a delicate balance, and it's like being on a seesaw constantly. So we appreciate you.
Thank you. Matt, you had a question?
Yeah, some of the questions I've had from parents is regarding athletics in the area of cheer and dance. I know they weren't on the CIF mandated future sports list, but is that a site-based decision or is that a district decision not to start that?
Neither. It's not, there hasn't been any ban on that. There hasn't either been any specific guidance that says they can. So we would want them to do the same thing we would want the robotics people did, is to reach out to their principal or reach out to us and say, hey, can we get a special dispensation on that? We think we're similar to robotics, or we think we're similar to the athletic strength training and conditioning. And as long as our team can confer on that, and Eric and I and the team feel that it is consistent with that and can be managed, we would seek the same kind of process, and they would need to go through the same kind of approvals. Eric, did you want to jump in?
Yeah, thank you, Dr. Rice. So lots of different guidelines, right? So the athletics is in one category, cohorts are in another category. I just like Dr. Rice was talking about band. So different type of instruments can create different types of risks. So although certain types of bands or instruments have said, go ahead, others have said, no, you can't do that yet. I believe I saw somewhere the guidance was not cleared for dance and cheer yet, because obviously cheer, when you have yelling and stuff, that produces a lot more droplets. I would need to double check on that, Board Member Alvarez, before we gave any specific answer to those two. But like Dr. Rice says, if we had a request, we would definitely evaluate it then.
Great, because I can see them also going to like a conditioning level, kind of like our athletics are, and not, hopefully not doing the cheer part of it, but doing just the physical conditioning part.
Sure, we would want to be, am I muted or am I okay? You're good, okay. Sure, we would want to be equitable for all those similar activities to the degree we can. Okay, thank you for that. Good questions.
I actually did have a question, Roger, that I asked you yesterday, and just wanted to ask it with the staff. In a meeting yesterday morning with our elementary school counselors, I suddenly realized kind of the challenge that some of our staff face who interact on a regular basis with a variety of cohorts of kids. And so what is the plan for creating a space that maybe is outdoors or is kind of more, less likely to transmit disease than a counselor's office? Or are there different protocols for cleaning between groups? I would imagine the same thing is true for our psychologists, our speech teachers, that sort of thing.
Yes, so what I would share about that is every site's different, and you can go walk around the campuses and they're all different, but I'm going to stick to the elementary right now since that was the question, and we've been sticking mostly to elementary on a lot of these issues. What I would share with you is that we need to work with our principals to find out, like, who are these people, where do they work, what does their situation look like, and go in and do just like we did with those classrooms and set them up appropriately so all those people can have the space that they are comfortable working in and have the confidence that they're not going to put themselves or the students at risk. That's part of the work that we would need to do to the degree it hasn't already been done over the next, I would say, 3 or 4 weeks. And that could be done outside too. I know you had mentioned that. I have seen that be done effectively at Blanche Reynolds in the Homestead program already. I know they're making extensive use of outdoor space, meeting with their folks. Eric?
Thank you very much.
Yeah. Dr. Rice, I would just point out too that working with our principals will be key on the cleaning too, because the custodial supervisor, Lupe Gallegos, is meeting with all of our principals to make sure that they have a discussion with their site custodians to know schedules for people like that. So if they need additional cleaning during the day, that can be set up and taken care of.
Thank you, Eric.
Additionally, really quickly, I'd like to add that we did poll the principals and asked for additional items that they wanted to have done so that we could start preparing as well.
Thank you. Okay, so additional challenges that we would need to work on would be, I talked about staffing a little bit, and this is really the largest challenge that we have. Again, it's not insurmountable. We can deal with this, but as we look at the survey data, there's potentially as many as 22% of teachers that could request distance learning only assignment, and potentially as many as 37% of students could register for distance learning. And we have to remember that it's not likely that site level breakdowns will be evenly distributed or that grade level breakdowns will be evenly distributed, and that could trigger the availability of substitute teachers. So how does that play out in reality? If we only talk about elementary school, and that's really, I think, the wise course of action right now, that's my best thinking, is that we have 251 full-time equivalent teachers in our elementary programs. If we took a rough estimate of 20% of those teachers requesting distance-only assignments, that would be 52 teachers. And if we took about 25% of the students in elementary school, which currently is 6,584, that would be about 1,600 students on distance learning. And you do the math, and it's the class size right now, if we accommodated everyone who made that choice, would be about 31.6. So what that tells me is that we're in the ballpark. That's actually a very encouraging thing. I'm not saying 31.6 is a great class size by any means for elementary level, but what I'm saying is it's not 52.7 or 8.6, right? If there were a mismatch either way, to a much greater degree, it would be very hard for me to sit here and say that this is a doable thing. At that point, I would probably be saying this is not a feasible alternative, and we're going to need to have everybody come back on the same program. That is not to say that doability equates to the lack of disruption. It doesn't. Certainly, there's going to be some disruption if these numbers materialize. But if we got the numbers that are here or close to those numbers, we're in the ballpark. If we wanted to get the class size down to say 26, for example, then that would require another 14.8 teachers. Likely what we would do, and I'll walk you through this just as a visual, is that I've asked Greg Bayless already to look into how we could register our students, having them choose between distance only or returning to in-person hybrid instruction. We would take that registration, try to match it up with a similar instrument that we would give to our teachers to ask them to, it would be like a posting. It would be a distance learning elementary school posting, and people would have to, teachers would have to reply by a certain time. And then what we would do is we would develop a matrix that shows how many kids at every school requested distance learning, how many teachers at every school requested distance learning. And to the degree we can match those up, we'll match those up, and then we'll adjust on the back end with the teachers who are left. For mismatches where there are either too many kids or too many teachers at a given site who request distance only, we would be centralizing those, right? Like we would have to consolidate 3 kids from Mound and 8 kids from Poinsettia and 10 kids from Elmhurst, and put them in a teacher from Montalvo who requested, and there's not enough kids at Montalvo, and that teacher takes those mixed cohorts of kids at the given grade level where they are. So is that going to be a challenge? Of course, but that's the commitment we made if we want to honor teacher and family requests to be on distance only learning. I have been asked many times about what that means for long-term enrollment. So in the past, before we had this distance learning experience and we knew the numbers, I think there was some thought that potentially you would have to disenroll kids from their school, and does that mean I'm going to lose my school of choice at Mound and all of that? My strong inclination in the strongest possible terms is no. I don't think that's right for families or for teachers. I think what we would try to do is work with our technology folks and our directors to find a way to enroll kids in kind of a separate track called distance learning or whatever we call it, and that's how they get their teacher assignment, but find a way to leave those kids enrolled at their current school so they don't lose their slot, they don't lose their school of choice, and all of that. So I'm going to ask Dr. Bayless if he has any updates on that process that he's been looking into.
Sure, I can speak to preliminary conversations that I've had with technology department, and that it is possible to have a registration module similar to what happens at the secondary level, and it can be applied to the elementary school level, whereby families register for courses, or in this case, they'd register for a specific program, at which point we would, just like you said, Dr. Rice, sort of corroborate that with school site specific teacher indications of whether or not they are going to request being on a distance learning teacher or a hybrid teacher. We'd match those up as best as possible. And in some cases, like you said, if a school had too few or too many teachers or students in any one program, we would combine them up in a separate track, retaining their school enrollment, but on a separate track in our student information system, and house them that way. So our elementary families are not used to doing that kind of queue registration, but for families who currently have an elementary student, but also have had experience with their children in the secondary environment, registering in queue for courses is typical standard. We've been doing it for years. And so that's something that we would implement in a very simple way for elementary families.
Dr. Bayless, could I just ask, so in the survey, one of the things that we saw was that parents said, I'm all for going back to school if I can keep my kid's teacher. And then there was less certainty, or it seemed like there was less certainty if they were going to change teachers. But just so I understand, we would not know that information before parents were expected to register and make a choice.
My best guess at this point, without having worked through the details and the timing of us constructing this sort of registration module, is what you said is correct. We wouldn't know in advance whether or not students would be able to retain their teachers. So really, we are at this point, unless we're able to come up with a different plan at this point, we just have to ask families if they want to be on distance learning or in a hybrid scenario. And again, we're going to work hard and do our very best to make sure that current teachers are aligned with current students, current school sites are aligned with their population of students. But there is the possibility that there could be some switches. We hope to minimize that, of course.
Yeah, no, and to be clear, I mean, I'm not suggesting that that's something that's in our control, but I do think that we want to be upfront and communicating that to the public that, we could try our very best, but it doesn't mean that your child's teacher or your child's sort of temporary school wouldn't change in order to accommodate having everyone in person who wants to be in person and everyone distance learning who wants to be distance learning.
That's true. So what's always true for secondary registrations of these kind, students register for courses, not for teachers. A lot of times when there's only one teacher that teaches a course, a student sort of knows what teacher they're going to get, but sometimes that changes, and that's certainly not the case for core. So that concept that families and students are registering for a program or for a course, they're not registering for a teacher, that would have to be in effect here in this new system.
Yeah,
Dr.
thank you.
Dannenberg, did you have a question?
Yeah, as we do this, are we going to be looking at how well the students have been doing on distance learning? In other words, if they're doing nothing on distance learning, are we going to allow them to stay on distance learning because that's what the parent wants? And basically the same could be said of our teachers. Are we going to be working with those teachers that may not be as effective with distance learning as some of our others? So just things to think about.
So yeah, we do need to think about that. And I haven't had a time to percolate on that a little bit, Dr. Dannenberg, but what comes to mind is the relationship between grading and someone's school choice is tenuous at best, right? Like we don't typically do that. And then secondly, we would have to work with our teachers, union leadership to talk to them about that aspect. I think what we've learned is Dan and his team have been very candid about where the challenges are and where the difficulties are with distance learning, and about wanting to accommodate teachers who have discomfort with one model or the other because they do better or not in one model or the other. And I think it's more likely that teachers would be seeking those settings where they think they can thrive. So that would be my response, but certainly your point is well taken.
And then I also received a question from one of our principals in the chat that can we clarify if families are asked to make a choice in terms of their enrollment, would they have flexibility to change their mind?
My answer to that would be probably not. I mean, this is hard enough as it is without folks migrating back and forth from one program. If it's one kid, like think about it, right? If there's one kid and they want to go from distance learning back to in person and we check that class and there's room, the tendency is to say, well, heck, why not? But then if there's like, 50 of them, the word gets out and there's like all these people wanting to go back and forth, it gets to be completely unwieldy. Okay, we ready to?
Wait, are we going to go in order? Is Matt next? Because I have a couple questions.
I'm not sure if this is on the slide up forthcoming, but because of those exact questions, when a student tests positive and then has to be taken out of the classroom for 10 to 14 days, what model would they fall into if they had the hybrid model and then you had the distance learning? Because now if they were in the hybrid model, they're going to distance learning basically from being out of class. And how are their instructions being taught?
So are you muted? Oh, there we go. So we have options, and that's something our team needs to talk about. One option is if a kid is in-person learning and then they get COVID or they get exposed, I should say, and they're quarantined for 14 days, that we look to the corollary distance learning setting teacher and what is their class size, and maybe we have to have that person attend that other distance learning setting for those 14 days. That's one option. Another option is, to the degree we have mismatches and we have centralized teachers assigned to take 3 kids from here and 4 kids from there and a few kids from there, and they have room in their classes, that we would ask that student who's being quarantined to attend the centralized teachers distance learning so that they get some exposure to instruction during their absence. So we do have a couple different ways to do that. If someone's on distance learning and they were somehow exposed outside of school or whatever, there's really no difference, right? They're just at home and they can attend school when they're quarantining. It's the kids who are in the hybrid model that we would need to try to find a place to see if they can get the benefit of instruction during that time.
Thank you. Go ahead, Velma.
Thank you, Matt. My question is this: when we were discussing this back in July, and Sherry Ulau from Foothill was saying that she wanted to make sure that the students that were registered in her class remained on her roster. I think that when we do go to this model, we have to make sure that they understand that it's staying with the option of the school, not with the teacher and not with the teacher's roster, because you might have one teacher that would think nothing of spending extra time taking those 2 or 3 kids that are staying home and still teaching them and grading them. But that is contrary to the contract with the teachers. It would be a nightmare. We could have all kinds of issues with people bringing grievances. I just want to make sure that, just like we just said earlier, that they understand you're not staying on the roster of a teacher. You're staying with the option of the school that you chose in the beginning of this pandemic that you were accepted for, whether it be the Foothill option or the bilingual options or whatever special option you took, that you're not in your boundary school. You stay with that school, but not with a teacher or on the roster of that teacher, because the teacher that's doing the online learning should be the one that has the authority to grade the student accordingly. That's one question. If you want to address that, Roger, I'll bring my next question next.
Well, the complexities that you allude to in that question that's one reason why I'm not even talking about secondary right now. I'll get to that in a couple slides, but I just can't state strongly enough how untenable secondary transition is right now. I don't recommend that at all.
I agree. And then there's 2 questions I have that really are not related to this slide, but they were just the previous slides and we didn't take a minute to ask questions. One was, during the presentation, and Dr. Levin alluded to this several times, 2 people at each school to do the screening and whatnot. Have we discussed that? Did I miss something, or is that something that is still in the planning stages and that's just a suggestion that he has? I mean, would that be additional staff, or could we use some staff that maybe isn't able to do their particular job? I just want to make sure that I didn't have a senior moment.
Yeah, so that's been a requirement from pretty much from the get-go. And I don't know if Anne Marie is on the call, Anne Marie Bidlingmeyer.
I thought he made it sound like 2 additional people. That's where I guess I got confused.
No, it's existing staff.
Okay, gotcha.
Dr. Rice, I can address that if you'd like.
Yes, please.
Okay, sure. So we have submitted our reopening plan long ago to VCOE, and myself and Anne Marie are the 2 designated contacts with Ventura County Public Health. I wanted to point out also that in addition to that, Anne Marie sent me a text earlier, and she just wanted to kind of remind everybody that with regards to the contact tracing, every nurse and every health tech has already had that training and been doing that for years previously with all sorts of other types of diseases and things that have happened with our school. So we already have that in place. Both of us have already been in contact with many occurrences with Ventura County Public Health. So yeah, that's already in place.
I thought that wasn't, I just wanted to clarify that it wasn't additional staff that we're going to have to put on just to reopen. And then my other question was, I had been told at one point that, and this is for Bill and you, Eric, that if a teacher needed, like say they use certain things in their classroom and wanted to have the misting or the fogger or whatever we're going to call it in their room, is that something that's going to be automatically done, or do they have to put in a request through facilities, or do they do it through their school? My concern is, having been a classroom teacher, is that oftentimes a request from a teacher goes and sits on someone's desk when it might need to have some priority. So I want to make sure that we have a clear way for a teacher to ask for additional help with cleaning or making sure that their areas are done the proper way without delay. So it doesn't take a week to figure out, well, who was supposed to have done that? And now you've had 3 or 4 cohorts of kids in there touching things that other people touched.
Yes, well, Trustee Lomax, I can answer that. We're going to be doing close support and monitoring of what's going on at the sites as far as cleaning. And the principal will need to, the teacher will need to go to the principal and give us that information. Just like we're doing now, where we know which classrooms are being used at the schools. That's how we're getting the list of which rooms are used, other than what the custodians already know, just to make sure they're getting covered.
Okay, and so we just want to make sure that all the principals know that they have a designated person if they're not available. Somehow, I just don't want to see these requests sitting on a desk somewhere. I'm not criticizing anyone, but I know how it works on my own desk. Oh yeah, I'll get to that. And then I look back at, oh no, I didn't get to that. And the cleaning part is something that we are guaranteeing our public that we're doing to make their children safe. So I want that to now have we've never had to do this before. So just make sure the priority is there. And
pardon me. Go ahead.
No, you're good. I just said thank you.
Okay.
So 2 questions, and I apologize in advance that the second one is a doozy, but first up, so just because it seems like there is still some confusion about the 2-point people at each site. So there are 2, Eric, you're already shaking your head. There are people who are responsible at each site for monitoring that, or no? Because my understanding from public health was we had 2 people at each site who were our point people, but that is different than what you're telling us.
The requirement from public health is 2 designated contacts for each district, not at each site.
And so each site has, who is the point person who?
One thing we discussed earlier this week was revising them a tad to update them and resend them back out. But basically principals are in contact with myself and the respective appropriate HR department when there's an issue or a potential exposure, and then we follow up and go from there.
So the complicating aspect of that is that not all of our elementary schools in particular have a health tech or a nurse on campus during the entire time that students are there. So who would handle those things in the absence of that person?
We've talked, we've had some conversations about that as well. I will let Rebecca follow up with some comments, but we've talked about potentially additional hours for health techs, but the employee issues are still going to be directed to the respective HR and to myself. The potential student issues, those are the ones that will be directed towards the health office, either the health tech and or the nurse at that respective site.
And I know Rebecca's going to jump in and talk about some of the health tech issues, but I feel compelled to jump in and say, are you going to mute? There you go. Regardless of who's at the site, it's the principal. Like, I can't say that strongly enough. I would never want a positive result of a student or a staff member to go to the nurse or the health tech person directly to Eric. Like, I would always want it to go to the principal. The principal should know every time there's such an issue on their campus. So that being said, Rebecca?
Yes, thank you, Trustee Rodriguez. We are looking at ways to make sure that we have more access to health techs on site across the districts, especially for the elementary schools, since that's what we are referring to. We had a meeting with Eric Reynolds and Anne Marie and myself in HR, and we were discussing what we could do to ensure to our public that we always have some health person on site that can help Eric as far as reporting goes, because there are a lot of reporting requirements. And so that was an additional step that we're already looking into. We also want to look into having written procedures, which Eric has been working on, but just making them a little bit more publicly known as to this is what you do when, this is what you do when. And I know Eric has been working on them and sent them out probably multiple times, but we're going to reiterate them and make sure that they're very clear for our campuses when we go back to sites.
Okay, thank you. And then my second question, which is even more
Before you get to your second
complicated.
question, Sabrina, I'm sorry, because this piggybacks on what you just talked about. Does this model that you're talking about apply to all of our facilities, including adult ed, and are already like El Camino, or schools that run differently than our normal, I don't want to say normal, that's not, than traditional campuses?
I would say right now, specifically, we are focusing on elementary. So when we are talking about planning, because that's the first one that will be coming back to campus on a regular basis, so we're trying to focus and stay there. I think the model will probably look a little bit different as we go up in grade level.
Okay, and so my other question is completely unrelated to that issue, but goes back towards the sort of shuffling of students and staff. And so when we ask families to commit to this model, will that include families who are currently at Homestead? And like, would they have the option of returning with their hybrid model if they were at Homestead? And secondly, I know I told you it was a doozy, would families who didn't want either the hybrid or continue on distance learning have the option of switching in now, right, to say a Homestead model if what we're offering? So I guess my question is, are we opening up all options again, or are we saying you are where you are, but now you have these other two options?
Thank you for that. My thinking on that right now is more of the latter. Like, I don't know how doable all of this transfer from school to school in the middle of the term. I just feel like that's a level of disruption that just adds to the mix that is not a very good idea right now.
I had a request for a short recess, but I also am just aware that we only have 45 minutes left, and I appreciate the fact that staff have dedicated so much of their time, especially our site leaders. And I know you guys have a lot on your plates right now, so I don't want to waste anyone's time. But is everyone okay with taking a 5-minute break, and then we'll return? I know Ms. Lomax has to leave at noon, and so we'll try to wrap up as much as
I'm a little bit more flexible on that, but not too much flexible.
Okay, so we will be back, let's say 11:20 on the dot.
distancing not going away until we've all had our vaccination, that seemed pretty darn clear to me. And as long as that exists, that means multiple cohorts, right? It means that when you require kids to be 6 feet apart, we're probably not in the business of going back to all day, every day for all kids anytime soon until that reality happens. So let's keep that in mind. The other ones are just logistical challenges that I think we can overcome. I know Kara and her staff have done a wonderful job, but depending on who's open and who's not, that'll create some adjustments there. Ari and his team will be required to change what they're doing now and go back to transporting kids, and I'm sure they're probably looking forward to that. And then, as you've seen in the survey, and as you will see as we spread it out, there's a very strong split, right? Like there's no clear vast majority supporting any one single course of action, with the exception of the small cohorts. Everybody loves at 75-80%. Folks like the small cohort idea and incremental progress. The rest of them seem to be fairly well split. So making everybody happy is probably not an option at this point. So moving forward, I want to remind the board that at the last board meeting where we discussed this, we kind of landed on the modify the course option 2, which was to stay distance only at all levels for now, but to continue to implement the small cohort guidance in the areas that are outlined there, and continue to make progress getting kids back incrementally into those milieus, and we are certainly working on that. So we have continued to work on expanding these models, and we would do so as soon as possible. I think I would just look for either this wouldn't really require a board vote because this wasn't part of the model that was voted on last time, just kind of consensus towards the end of the meeting that, yeah, let's go ahead and keep building those models. That would be great to hear from you. And then what I would share with you is that, and it's not typed here, but it goes without saying, but I'll say it anyway. An option that you have is to do nothing. Just honor the decision you made in July and stay distance learning for everybody through the end of first semester. But if we are truly considering a return to in-person instruction prior to that, in recognition of us moving to the red tier, staff has been talking and meeting, and our best thinking would be to present you with the following considerations. One would be to identify a reasonable date for reopening elementary schools that would include a revised plan developed by the Distance Learning Committee to address the learning that we've had over the past 6 weeks, including the time spent with students, the time spent on distance learning, and how that all the logistics could be tweaked to make the jobs more doable for our teachers. 2 would be accommodating student requests for the preferred method of instruction, accommodating teacher requests. We went through those two considerations in great detail. Continuing our consultations with our VUE and VESPA to be sure that our plans are consistent with our MOUs, and or revising the MOUs to reflect the new realities. My best thinking right now, until that dynamic around social distancing changes, or at least to the end of the semester, would be to have the secondary schools remain on distance learning as previously approved for by the board. I've talked about the reasons for that recommendation to you. Again, I wouldn't say that would be necessary for the rest of the school year necessarily, but at this time when we would be engaged in bringing back elementary school students potentially, I believe that to be a wiser course of action and an incremental approach to bringing everybody back in an environment that is much easier to manage logistically and safety wise and than it is at the secondary level. So that's a consideration for the board that I would like you to think about. And in terms of next steps, Obviously, we need some clear direction from the board on what you would like us to prioritize for moving forward to in-person instruction. We would then begin working on logistics for our small cohort supports and services, as I outlined earlier on 2 different slides. We would work to prepare our enrollment plan and our registration at the elementary school levels, asking parents to choose, giving clear and transparent warnings about the potential consequences like that. I could envision statements that say, you know, I elect my student to be in a distance only setting. I understand that, and I acknowledge that A, B, C, and D is possible. So it would be with full disclosure. We would also be working to post distance learning only preference postings with all of our teachers to see who's interested in that, and then you know, go into the war room and put everybody up on the board and put all the kids, you know, on the matrix and just try to figure it all out. That is quite a challenge, but I think we can do it if we get the numbers to be along the lines of what we described earlier. And then it would be a matter of planning all the logistics for transitioning to this in-person model. With that, I want to share with you a recommendation if you are considering coming back to in-person instruction at the elementary school level. Hopefully we've presented the realities on the ground sufficiently that there's a recognition that this is not going to happen by the 21st of October. I know that there is a legal ability to do that, but that is not in line with the realities that we need to take care of to open up. And so my best recommendation at this time would be to consider with the board's approval, returning to in-person or hybrid at the end of the next grading term, which is at the end of November. And I'm going to let Gina talk about some of the dynamics that'll happen between now and then, which is why she would make that recommendation with me. And that is, there's a lot going on between now and then. And we don't want to disrupt those conferences, grading, those kinds of things. Gina, can you jump in just a minute and talk about the end of November date?
Yes, of course. So teachers are already preparing on looking at students' academic progress and having the opportunity to communicate that progress with our families during parent-teacher conferences, which happens the 5 days prior to Thanksgiving break. And so my thinking is that it would be best for families to have that information and really have an understanding of where their child is at with their strengths and opportunities for progress this school year prior to making any changes in the learning style or program that we offer families. I really do feel that that's essential. And so the soonest that we would be able to make that transition then would be November 30th, which is the Monday after Thanksgiving. And I really do feel that that would be the soonest. And so in the meantime, in addition to some of these next steps that Dr. Rice has laid out, we would be working on the instructional plan with the teachers. We've reconvened the distance learning committee, maybe possibly now the distance learning and hybrid committee, but working on what the schedule would look like for hybrid students, Group A, Group B, that was agreed upon, any adjustments that are needed, knowing what we know now. And then the recommendation for the distance learning only, would that be just the current schedule that we have in place? Are there any adjustments we would want to make? And just working on those schedules so that when we are ready, we have all the schedules with the experience of the last several weeks.
And as a corollary to that, I would just, last thing I would say is that it wouldn't be radio silence between now and the end of November. We would be working to continue to incrementally implement in-person activities in those small cohorts that we described earlier. so that we could have several of those operating and learn from those experiences prior to the date that we would open the elementary model at the end of November. So that's the end of our presentation. And I think I've given you pretty much every bit of information I have, all the things we're considering, all the dynamics. I've laid out the most conservative option for you, which is just stay the course to the end of the semester. And really what I think is the best and most aggressive option, which is to open up our elementaries at the end of November. I wouldn't, at this time, absent some additional information or additional guidance, feel comfortable going farther than that.
Can I ask a clarifying question before we begin the discussion? It would be around the idea of opening in November, which is the recommendation for the elementary school students, or possible opening of those schools. From what I've heard and understand, it doesn't, if the parent decides to stay distance, or if the parent decides to go to school, they're not going to be guaranteed the same teacher, only the same school site. And we won't know the answer to that either way. So if the parent says, I'm going to stay distance, or the parent says, I'm going to go to school, they have no way of knowing if their teacher would still be the same teacher that they've had from the beginning of the year. And that's correct statement?
Yes, that's a consequence of honoring the distance only requests. The smaller numbers who request, the better chance they're going to keep their teachers. The larger numbers, the more disruption.
So Dr. Dannenberg, would you like to start us off?
Dr. Rice, I know that you're sitting here basically recommending we leave the high schools alone at least until the first semester, but have you given any thought to what those are going to look like when we do open them up, whether it's at the semester, next year, next week, whatever it might be?
Yeah, so the model that was approved in July was our best thinking in July. And I want to acknowledge some of the conversations I've had with current teachers and with Dan Nelson about some of the demands of the hybrid model, and say that what we would do is we would have to sit and reconvene maybe a secondary hybrid model committee, just like we had the distance learning committee, to tweak those models more favorably and make them more doable. I know that in general, what I hear strongly is that teachers would not prefer to do both. They would not prefer to do distance learning and in person. They would prefer to do one or the other. But if we are contemplating going back to in person at some point, which is legal now, then some degree of hybridness, if that's a word, is required because the law requires daily instruction for every kid. And I know that that's widely recognized, but it's how do we pull that off and make it doable for our teachers, so they're not, burning the candle at both ends, and so they don't burn themselves out. And so that's going to require some ongoing collaboration. I have a lot of faith in our teachers and in our teacher leaders to give us the benefit of their best thinking and guide our models in that respect. And I would look forward to that being an ongoing conversation. And to your point, Dr. Dannenberg, I think leaving them on distance learning for the first semester would give us the time to do a good job of that. Whereas if we tried to bring them back at the same time as the elementaries, I can't support that right now. I really struggle with how we would pull that off in a meaningful way. There's just too many variables at the secondary level.
In discussion with your colleagues that have secondary schools in their districts, what are they overcoming any of these problems? Are they just charging ahead and it could basically, excuse my phraseology, but go to hell in a handbasket in those districts?
I only know one district in the East County that is doing that, and we'll wait and see how that plays out. The words "not ideal" were used to describe kind of that model of doing things. I don't want to say a whole lot about that because I don't want to make any disparaging or challenging remarks. But I also want to say that when we met with all the superintendents yesterday and every other meeting, we all agonize over the secondary schools in this milieu. Like, all of the high school districts are struggling with the same issue, and none of us feel very comfortable about this dynamic.
Thank you. Yeah.
Yes. So Dr. Rice, it looks like we have 43 days. The 21st of October was the day we were to open, or is the day that schools can start coming back. We have 43 weekdays left till winter break. 34 possible instructional days. That leaves us, because of Wednesday being a cleaning day, would leave us with, if we were to open on November 2nd, 26 days of instruction, meaning that, but it's only half the kids because they're only going 2 days during the week. So that's 13 days that they're in front of a teacher. If we open up by November 30th, that's 12 days, 6 days that the actual students will be in person in the classroom. I think that's a feasible and a good look at what we can do in that time if we do go live on November 30th. Also, it's right after the trimester, and obviously the quarter for the kids, the students. The concern is, it looks like for secondary wouldn't be till January 22nd. Am I correct on that? If we were not even looking to bring them back till after the semester?
Yeah, that would be correct. I don't have the date memorized, Matt, but yes, whenever whatever that date is for the end of the first semester.
So I'm in support of definitely bringing back the elementary first at that first date, and then obviously looking at later for the secondary. My biggest concern for the elementary level would be, as I saw with something that Dr. Levin really stuck in my mind, was the airflow issue. And how is that going to affect our elementary schools? Where are we at in those where we were talking about in the master's facility plan about lack of air conditioning? That would be a huge concern on the airflow issue. Can we go a little bit in depth to that?
I'm going to let Bill talk through what's currently in place and maybe a few ideas you have about increasing airflow in rooms that would be in use, and
Yeah.
including using outdoor space as well.
Yes, absolutely. Yes, Trustee Alvarez. Just so you know, where we don't have AC, we still do have heat systems that have fans. So we do have fresh air makeup that we can run the fans on those systems. We have looked at using like a MERV 13 filter, but finding out from our vendors that puts a lot more strain on our equipment, especially our older equipment, and they'll clog up and they'll break down more often. And with what I'm hearing from the county health is the more air turnover, the better. So we're doing our filters on a normal change out schedule 3 times a year, every school, putting in brand new fresh filters. So we're getting a lot of good airflow, and I'd highly recommend doors, windows open when the days are, when it's not too cold, but we will have those cold days, but we're just going to have to try to get as much air flowing through those rooms as possible every day.
Great. And my only last thing is more of a comment than a question, and it's going to the hybrid schedules at the elementary. That right now that the students are seeing 4 days of live instruction with their teachers, 1 SEL day, and they're going to go to only 2 days of really live instruction. And what's going to happen on those other days, and how are they going to be monitored without having live instruction on those days? So I hope that everyone watching and that our parents really understand that they're losing a little bit more of the actual daily interaction with their teacher to go to this hybrid model in person. So I just hope we really hone that into the parents so they understand that.
Actually, Matt, I think maybe Gina, do you want to address some of the changing thinking of the distance learning committee?
Yes, so we've only had one initial committee meeting, and it wasn't widely attended. And so we'll keep you posted on those continued conversations, but all students would continue to get daily live instruction. And so the group that is not in class that day would also receive daily live instruction. So every student would receive daily live instruction, whether they're on the hybrid model or the choice model.
And that would just be a different teacher that'd be teaching the distance part of the hybrid model?
So if you're asking like for an A-B group in a hybrid model, the B group would be taught by the classroom teacher when they're not live in the classroom that day. So for example, the Thursday, Friday group, if we kept with a similar model, the Thursday, Friday group would have their live instruction or could have their live instruction with their regular classroom teacher in the afternoon, potentially on those days. We haven't worked out the details of that schedule yet, but if it was the AB group, they would be taught by their classroom teacher. They would not have a second teacher that would do that live instruction piece.
Okay, great. I look forward to more information on that. Again, just another one of my concerns is the workload for the teachers.
Yes.
Like, how are they going to find that balance with having, if they have children also of their own? So definitely look forward to more information on that. But I do definitely support the November 30th if it's feasible and possible.
And I will be working with the teachers. And I know Mr. Nelson is invited to our meetings. So we'll be working together to build some consensus on the schedule, taking that absolutely into consideration workload.
And I saw that Mr. Nelson had his hand raised.
I did. Thanks, Trustee Almaraz, for asking the question. Couple of quick things, and also thanks, Trustee Lomax, for the comment earlier about problematic. We have really worked hard. VESPA has as well to try to be here to make sure that we can get the kids the best services we can as soon as we can, because that's really all that anybody wants is get schools open as quickly and as safely as we can. So we've been kind of alluding to the teacher workload, and one of the things that may not be clear but has become really clear to us is distance learning is that much harder to do than in-person learning. And so before, if you were teaching for an hour, you maybe had 20 minutes of prep for that hour. So you teach 7 hours, you get about an hour and a half of prep. Distance learning is quite a bit more than that. So we got teachers who are typically working 9, 10, 11, 12 hours a day just to get the things modified, graded, et cetera. Doing it and doing the best we can with it, and appreciate all the patience that the parents and the families have had, because we know how tough it is. It's tough for us. It's really tough for them. Going to a distance and a in-person model, all morning long, you're going to be in person, which is great. You can see kids. And then in the afternoon, you're doing the distance thing that you normally started in the morning. And so you're pushing all of that workload further and further into the evening. So I've got folks who are finishing up at 7, 8, 9 o'clock at night. They don't know how they're going to do this in a distance learning model. And so that's the conversations that we're having. And both Dr. Bayless and Mrs. Wolowitz have been working really well with us. Everybody's trying to get to the same answer. Everybody's trying to get to how do we do this so that the kids get everything they deserve and everything that the parents want, and that the teachers aren't burning out on Tuesday and can't function for the rest of the week. So Dr. Rice is right, as usual. It's a really tough nut to crack, but we're all working away on it to try to get there. So I appreciate the support of the board and the support of the folks working with us, because we're really all trying to get the same thing. Let's get the best services we can for these kids and families as quickly as we can. We want to be safe, but we want to get this, we just want to go back to the best we can. Thanks.
Thank you for that, Dan. Velma, that's all I have.
Thank you. I have one question for, it could be Gina or Dr. Rice or whomever. It's been a while since we've actually talked to the public about our hybrid reopening schools plan. It would be very important, and the clarifying question here is, will the students be at school, the elementary students be at school every single day?
No. So no, that's not going to happen until the social distancing is not required anymore. And that's what I was alluding to when Dr. Levin quite clearly said that's not going away until we all get our shots, basically. So that's the challenge, right? How do we provide what the law requires, which is daily live instruction to the kids that are not on cycle that day to be in class? Those kids by law have to get some live instruction. That's the challenge.
And I knew the answer. I just need it to be said because there's a misconception out there amongst the parents that we're going to open the doors and their kids are going to be in school every day. You can't if you have to have the desks so far apart. And the facilities did a great job back in July showing us that we could only have so many kids, and they actually went out to each classroom and did a map of each classroom based on the square footage of the classroom. Whereas one school might be able to house 16 students, but this school could only house 11 or 12. And we really appreciate all that your people did, Bill, to that. But I think it's incumbent upon us to remind the public, this doesn't mean the floodgates are open. And your lunches like you're used to getting before for your kids is not going to be the same. We are not allowed to have kids go through a buffet line. It's all going to be prepackaged if we even provide lunch. Those are the things that I think it's very important for us to make sure that our parents, when they're making these choices, those things are included, not just you're not necessarily going to get the same teacher. And I know you'll do that, but I just want to say that as a parent, I mean, I hear all these things like, I can't wait till my kid's gone every day. Well, you know what? That's not going to happen in the very near future. So that's just something, a reminder. And also, you talked, Dr. Rice, about setting up a committee to talk about when we do go into the secondary stage. I think that sooner better than later is really important, because my fear is what we're talking about right now in possibly opening up elementary schools. This is not going to be an easy task. The very first thing, in my opinion, and I'm not going to tell you how to do it because that's why we hire y'all. But you first have to find out from the teachers. We have a survey, but you don't have a name on those teachers. You have numbers. Which teachers were they? Which schools were they at? I mean, I want the public to understand this is not something, because we're going to get criticized. Well, why are you waiting till the end of November? It's not something we can do overnight. When we get done and we see where it all is, are we going to have any issues? I know we have a wonderful MOU with the VESPA and VUEA, but are there going to be any issues that we didn't think about that may have to be renegotiated, or we might have to go back to the table to discuss to make sure that we're doing things the way we should? And I just want to make sure that people understand that we've been working hard. As a former classroom teacher, this is horrible, not having your kids in class every day. It's horrible for the teachers, horrible for the students. It's horrible for all of us, because we're all here. None of us are here for the money. Y'all know that we don't get paid what you do out in the regular world. We're here for your kids and to make sure that they get a great education. And it pains us that this is happening, but you all need to understand that. And I do know a lot of people are watching, by the way, to see what we were going to say. It's not going to be easy. It's not necessarily going to be exactly what you want, but we're doing the best we can. And then finally, off of that subject, I have heard some concern on the secondary high school level that in the online learning, that particularly in AP classes, for example, that they don't feel like there's enough student-teacher contact to make sure that the students are getting what they need to make sure that they're not falling behind. Now, I do know that the CSUs and the UCs, I believe both of them have said they're going to stay online for the entire 2021 school year. So this is just another good example of how our kids can get used to that, because we don't know if it's going to go on beyond that. But I do want to make sure that our kids, that somehow, if a parent has a concern that their students maybe not getting enough online, encourage them to call the principal, encourage them, if they're not getting anything from the principal, to call whomever the district is going to be taking care of that, because we want to make sure that no matter what we're doing, that the kids are getting the best education possible, which we always do. Don't get me wrong. Don't take this the wrong way. It's frustrating for all of us. There's not a single one of us that doesn't go to bed every night frustrated, wishing we could do more. We feel your pain, but we have to do what's right for kids. And in my personal opinion, when New York, several zip codes in New York had to close their schools because they opened them too soon and they started getting high numbers of COVID, that would be way worse for families and kids than to just do it the right way and go slow so that we don't have to close or we don't have to have tons of outbreak. So I think you guys are doing a great job. I trust you. I'll be happy to serve on any committee, talk to parents, whatever you want. And the only other, I'm sorry, one more thing. I'm looking at my notes here. I have them on several pieces of paper. One of the things that we have to remember going back to sending your kid to school sick, is that years ago when the state of California decided that there was no more excused absences. You either are in class or you're not in class. And if you're there, your school gets the money. If you're not there, the school doesn't get the money. I think that more and more parents were encouraged, send your kids. We'll let you know if they're bad. If they're sick or dying or bleeding to death, we'll send them home. And even parents were saying, well, they only had a little bit of a fever. We're in a different time now. And I'm hoping that at some point, the state or the federal government comes up with a way to compensate our school districts when kids have to stay home because they have a fever or they have a potential COVID symptom that we don't want at our schools. But I think that we're all of that mindset, go to school no matter what, because we need to keep the programs going. And that's not a criticism, it's just a matter of fact. And then totally off the subject, and probably I should bring it up Tuesday, but I just want to remind someone, Canvas and Q with grading is still a big concern for teachers. So we want to make sure that in opening elementaries, we don't get off some of the big issues that have been brought to our attention. But otherwise, I appreciate today. I appreciate the bringing in the people from the county, Dr. Levin and Mr. Vargas, he's not a doctor. I really appreciate so that we are making learned decisions. I think that's very, very important as elected officials, as we listen to everyone, we take in what they have to say, and we don't just make these decisions lightly. Thank you.
Okay, so in the last round, I somehow got skipped. So I'm going to actually submit my question on cleaning protocols, but so everyone knows, my question is, are we going to have them posted? Are parents going to know and staff going to know, everyone going to know, this is our minimums. These are what we're doing on a daily basis. This is how often the foggers are going to go in the classrooms. These are how many high touch surface cleanings there are each day. This is all of those sorts of things. I know that they're standardized, but are they going to be published would be my question. And I'll leave it at that. You guys don't have to answer right now, but if you could answer moving forward would be great. But in the interest of time, I'm going to move to the next. I'm going to go backwards. When we initially approved or was talking about the elementary model, I have my notes from that meeting, and there were two models that were approved by the committee in a A-B sort of style. One of them was a Monday, Tuesday with a Wednesday kind of social emotional down day. And then the second cohort would go Tuesday, Thursday, and they went for longer times on those days. The other model was to a track and a B track in the same day. That the first track would go AM, like 8 to 11, Monday through Friday, or Wednesday actually was still social emotional day. And the second track would go Monday through Friday, 12 to 3. I know that there were transportation issues and there was a cleaning issue between the cohorts that you guys were discussing as complications. But the main reason that we went the other way was to allow people that had elementary students and high school students or middle school students to be on the same sort of scheduling, that they would be going Monday, Tuesday, or they would be going Thursday, Friday, but it wouldn't be every day. The reason that I'm bringing this up is because if we're only bringing back the elementary school right now and not the middles and high schools, we don't have that concern. That's not as big a concern. And it would take out the worry that elementary school teachers have that they would have to do hybrid and they'd have to do online and in person. If you brought kids in every day in cohorts of AM and a PM model, that would eliminate the online learning, I think. So I was just wondering if that was a consideration or something that the district had thought about or gone backwards to.
So I don't think we would be able to meet the instructional minutes requirement doing that without having a substantially long day, but certainly we can look at that. I hear you. You're looking for a way to find a way to have teachers not have to do distance learning and in person. Certainly that's great, but I don't know that we would be able to do that without having the first group come in from like 8 to noon and then a break, and then the second group come in from like 1 to 5. Like I don't know that we'd be able to meet the instructional minutes requirement. So I'll let Gina address that or delve into that.
Yes, you're correct. And in addition, the families, when surveyed, did not prefer that model.
Okay.
Can I make a point of order here?
My recollection.
Gina, I apologize. Could I make a point of order here? We're here today. We already approved what model we would go back to. We need to do that at another meeting if we're going to change it, because we already approved it. What we're here to discuss is if we're going to go back on the model that we already approved.
Got it. I was just thinking about it because I've heard from a number of teachers that expressed exactly what Dan did, that they'd rather, and the only way I could think of that happening was the other model, that they'd rather not do both the hybrid and the in-person at the same day. So I brought that up. The other thing that I have is, if we're not going back to school in secondary until possibly next semester, January 28th or end of January, are we going to be doing, or do we have a commitment that we will do small cohorts, special ed, EL, and any struggling student? So students that are having difficulty with the distance model and the gap is getting wider, are we going to have a way to bring them back for sort of tutoring or enrichment classes or something to help them so that they're not coming back January 28th with Fs and Ds in large numbers, or, so drastically behind? So I'd like to hear from the district if they have a plan for that.
So that's what I was alluding to earlier about having kind of an RFP process where we got our team together and came up with these categories of small cohorts, whether it's academic intervention, EL support, special education, academic enrichment, arts, whatever. Put that out there, took the folks who are willing to do it, offered some kind of a stipend compensation for them to do that. So the answer to your question is yes. And it will look like whatever takers we get from that.
Okay, great. And then for El Camino and the schools that are different, would there be an exception or waiver for those schools to go back because they are one-on-one? Flex High School or El Camino?
So El Camino would not have any restrictions on them. They don't have to have a waiver. They could come back on the 21st legally.
Okay.
That's an issue to discuss.
Okay. And then the last thing, I jump in on what Matt said. I would love color guard, cheer, dance to be treated the same as any other athletic program, and make sure that those students and whoever is running their program is included in whatever process we have come up with to ask for permission to come on with whatever restrictions need to be in place. Like cheer, obviously they can't cheer, but they can at least work out. I would like to have the district reach out to them and include them in the athletic program waiver system that we've sort of put in place. So those are my main questions. And I want to see something happening in high school before the 28th of January. And I can't wait to see what we come up with. I'm anxious to get kids back in class. So thanks.
Thank you. So I have a couple of questions as well. I know that we were all able to see the survey that, we have the results from the teacher survey that you were shared with us. And we received from Mr. Nelson some supplemental questions about concerns that our teaching staff still have around returning to in-person instruction, but we still haven't received any information about our classified staff. And so I know I asked this at our last board meeting, but I'd really like to get a survey of our classified staff and understand what sort of where their comfort zone is, and also what are the issues that they feel like are outstanding, so that we can know what those things are. My second question is, do we have a sense on when we could begin to have our small cohorts in the elementary setting start?
Ms. Rodriguez, this is Andrea from Classified HR. I just wanted to let the board know that a survey has gone out to our classified employees. So most all classified employees have already returned on site and have been working either since this all started back in March. Maybe a group came back in June, and then quite a few came back in August. So the survey that we've sent out so far was to our instructional support staff and our bus drivers, because really they directly are working with our students, and drivers obviously aren't driving students right now, and our instructional support staff have had the option of working remotely from home. That data is due back to us by Monday afternoon. And then the next survey that we'll be sending out is to our classified staff who are back on site. But we want to get their input given the possible transition to in-person instruction. So we will have that information by early next week as well.
Okay, yeah, so specifically I had heard from office staff who had asked, like, you know, are you guys going to ask us how we feel? And so I think it's completely a fair question, and obviously we want to understand for all the people who are on our campuses, what is their level of safety, and then also, you know, what do they see in their, especially for those who've been back for a while, what are the things that they see that we want to address before we bring back students that have been concerns?
Yes, absolutely. And we did have a meeting with all of our school administrative assistants yesterday, and I did share with the group that survey would be out by this afternoon to all the other groups of classified that are on site already.
Great, thank you. And I saw Mr. Nelson had his hand raised again.
Of course I did, because when it comes to surveys, nothing makes me happier. I can tell you it's easier for VUEA to get surveys out because almost all of my members have access to a school computer, and that's how we do all of our surveys. When it comes to classified staff, they just don't have the same. Carol and I have been working together really closely trying to get a survey out, and I'm sure she'll talk about this in a second, but one of the biggest concerns for us is logistics. It's just really hard to get everybody on the classified staff access to a computer and the link to actually get the survey done. So she's been asking me to see what I can do. We've been working on it, but we don't have an adequate solution yet unless we are using their district email addresses, and we carve out some time for that. But I'm sure Carol can address it.
Yes, thank you, Dan. Yeah, unfortunately, I've had issue with personal emails, trying to get a hold of, trying to rebuild that database because it was lost during transition of leadership with VESPA. But with Dan's help, also the district's help, we have gotten it pretty much under control. But again, too, there's still issues with email accounts and people getting on their emails. And that's an ongoing problem that's been happening throughout that I've ever known, even being with the district. So, but, that's all getting worked out, and we are, but agreed. I appreciate you asking about classified, because even though they still are at work, there are challenges, there are concerns. There's concerns with the paras and transportation and child nutrition office, everybody. So I appreciate asking for their input, because yeah, they're affected as well. So, and they do have concerns, but thank you, Dan, for helping me with that. And I think together we'll get that information to you.
Thanks, Carol. And I think, for those who are maybe listening or watching remotely and kind of question, why are we pulling staff so much? I mean, I think one, obviously we care about our staff and want them to feel safe, but also they're already on our school sites and they're there. And so if there are problems in our protocols, we want to know that before we start bringing back hundreds of kids to our sites, right? So it makes sense for us to have, in my opinion, a strong sense of what's going on currently at our school sites, and then, fix whatever issues may need to be addressed before we start bringing our children and the majority of our staff back to campuses. So, and the other question, Dr. Rice, was about small cohorts.
Yes, just if I could, I'm not going to do this, but if I would go back and reverse the PowerPoint to all those slides that mention small cohorts, elementary is included in all of them. That wasn't just meant for secondary.
Yeah, no, my question was more specifically, when do we envision actually bringing those small cohorts onto campus? Like,
Well,
what do you think is a realistic timeline for some of our elementary school small cohorts?
Yeah. Well, so assuming that you all are like giving the thumbs up, yes, expand that, which that's one of the points on the guidance that I'm hoping to get. And I think I saw you all kind of say thumbs up. Then typically when you post opportunities, you first have to brainstorm what those opportunities are, the areas that you want to post. Then you post them for like a week minimum. Then you give people a chance to respond, tabulate the results, make the assignments. So 3 weeks to 4 weeks is not an unusual turnaround time to get something like that up and running. It's not a immediate thing.
Okay. And then, well, my last thing is really more of a comment, and that is that I think we should really start to communicate to families that the sooner they get their flu vaccine, the smoother this will all work in the fall and over the winter. Obviously, we want to keep kids healthy, but we don't want sick kids at school. So the more that we can do to help our kids and staff stay safe and during the flu season is great. Going back to your question about guidance, do you want, I mean, my understanding was we were going to probably take action on Tuesday in terms of as a board making an official decision, but there are lots of smaller decisions within that. So I didn't know, what guidance do you want specifically today? What guidance do you want on Tuesday? And
so the small cohort guidance would be great to get from you now, because that doesn't really require a vote. That's in place as a kind of a separate world unto itself. So if I had consensus around, yeah, go ahead and expand those in the areas that I outlined, or if you have any other thoughts, that would be good, because we could get started on arranging those right away. I think Tuesday is the day that we would be looking for a vote to either stay the course until semester or open elementaries towards the end of November, because you did take a vote to remain distance learning only. And in the absence of a vote, I don't think we could legally or appropriately change course. I think Velma had a...
I just have a question, Roger, and I meant to bring it up. I apologize. On our small cohorts, my granddaughter attends VACE and is learning front and back medical office. Online's going exceptional, but they can't do their labs. Are they going to be included in this, being able to bring students back into small cohorts to do their labs and things? I know that they're adults for the most part, but they still are under our umbrella of the school district.
Carolyn, do you want to address that?
Yes, thank you, Trustee Lomax, for asking that question, because we do have some skills that are required to have hands-on in-person for our CTE programs. We're hoping that will be considered for small cohorts as well. And we also have the gift of space here at VACE. So it's possible for us to, apply all the social distancing recommendations and to be able to bring back students in tiny groups, to be able to do things like blood draws, and also to be able to complete their licensures so that they can go out and go to work. So I'd hope that you folks would also consider adding adult ed to that.
You got my vote.
so it seems like, yes, there is board support for moving forward with the small cohort in all of its facets and flavors, and then we can talk on Tuesday more about the actual reopening of the recommendation to reopen our elementary schools at the end of November. And what on Tuesday will we also be discussing any news on the model, or will that be at a future date?
I think the direction on Tuesday would be to continue to work with our associations and with our distance learning committees to develop those models. It's not realistic to have that for you on Tuesday.
Perfect, thank you. Just trying to set realistic expectations. Not trying to say, hey, you should be working on this all weekend. Okay, great. So is there any other guidance that you would like from us before adjourning the meeting?
No, I don't think so, but I would like to take a second just again to thank Carol and Dan for their continued partnership. I'm seeing a lot of principals and other folks nodding their head. I think you alluded to that earlier, Velma, the fact that we have a collaborative group of folks that we can work with to give us the benefit of pointing out where the landmines are and where the upsets and challenges and hurdles are only makes us make better decisions and more informed decisions. So appreciate Dan and Carol, all you guys do, and thanks for being here today. It's been a long morning, but we'll get through this and we'll have a better product on the back end because of your involvement.
And I'd like to say to all of our principals and directors, we really appreciate you setting aside the time to participate. I hope you felt like it was valuable for you. These board study sessions are so different than our typical board meetings, and that there's a lot more sort of back and forth, and it's really helpful as we untangle some of these knots to have the benefit of your wisdom and your experience on your school sites. And when you see something that we're talking about that's kind of going sideways, it's really helpful for you to speak up and let us know that. I really appreciated the questions I got from the chat, so thank you for sharing those ideas with me and allowing us to ask those questions of public health, because I think part of helping our community to feel comfortable with this decision to reopen is making sure that the information is really transparent and that parents and students and staff can ask their questions and know that they're getting at least, our best answer based on the information that we have. So I really appreciate your time and thanks so much for being here. Board members, do you have any final comments?
Yeah, first of all, thank everybody for all their hard work on this, and really do appreciate our union leadership for their activities on this. What I would like to say, though, in any protocols that we come up with, Dr. Rice, is a mandate that all students, doesn't matter what age level, wear a mask, maybe with the exception for those that need to take them off for a speech pathology type thing, and or then if there's some type of medical exemption. But I think we need to have protocols in place that, one, they're going to wear them, and then what we're going to do if they refuse to wear them. Because I don't think we want to get in the political discussion. I don't have to wear it because somebody says I don't have to wear it. I think our rule ought to be that they wear them and just let it be at that.
Yeah, I appreciate that. The board seemed pretty clear about that back in July, and when the question came up at that time, what are you going to do about it? It's enforce it, right? Like if you don't want to wear a mask, then there's the distance learning program available to you.
And my exact sentiments from just as Dr. Dannenberg had said, thank you to the union reps. Thank you to all the staff, everybody for all the work they put in. I just wanted, again, just a tremendous job, Dr. Rice, in the presentation, being organized, being ahead of the information. I know this has been a real loss of sleep over this issue of reopening and trying to get us back as soon as possible. I know your eyes are on the secondary, and you're going to do a diligent job in making sure that if possible and when possible, it'll be possible to get them back. And excited about that. I know some of the parents are disappointed out there probably already on that front, but I know that we'll do a great job, baby steps, getting elementary going, and then moving forward and seeing what we can do to get the kids back in school. So thank you for all you do, and the executive staff for all they do.
I too thank everyone. Jerry, I agree with you on the masks. I do think that if a child is in with a speech pathologist, perhaps they could wear one of those face guards or shields. I know that they're not considered medically as safe because things can still get around them, but at least they wouldn't be the direct droplet danger. And by the way, some of our robotics kids are making those, and also you can get them very inexpensively. I appreciate everybody. Just so you know that it's my 49th wedding anniversary, and I couldn't have thought of a better way to spend my morning. Truly, I love what I do for kids. So thank you. And thank you all. It's not easy work and we get a lot of criticism, but just turn the other cheek and know that when you make a decision in the best interest of students, you cannot go wrong. Regardless who's going to criticize you, there's always somebody out there that has a negative opinion. Too bad for them.
I too want to thank you, Dr. Rice, for putting this together, and all of the executive staff, especially for including Dr. Levin and also Rigo Vargas, because that was so helpful. And hopefully it allays a lot of fears that people had in the statistics that they gave out, and the amount of spread that happened in essential workplaces and hospital settings. And so that we know that there's already models to follow that can be done safely or with reasonable safety in place now to bring our kids back. So I'm excited about what we're doing moving forward. And I hope for the public, I thank you so much for all of your patience, everybody's patience in this. I thank in advance all of our janitors for all the cleanings that they're going to be doing on our sites, because honestly, you guys are the front line of keeping this tamped down, and our teachers for instructing especially the littles on how to wear a mask properly and being patient with, it's going to be the bingo board of all the wrong ways that they put it on. So those sorts of things we'll get through. And I just, I just have an huge amount of appreciation that we are all part of Ventura Strong. And yeah, it's a great community to be a part of. And like Velma said, we really do have cooperation across the board, from the unions to the, any district staff, and also the parents and kids too. So thank you.
I just wanted to reiterate for those who have an interest in the data that was presented today, the presentation will be shared, as will the results of the survey. I think, these things do take time. Gathering that information is never as quick as people would like, but it's so helpful in framing the conversation, because I think it's easy for all of us, no matter who you are, to hear from your circle of influence, well, everybody agrees, right? Everybody thinks this, everybody thinks we should all be back in school. But if you look at the survey data, it's pretty clear there are a lot of different opinions. People feel very differently about how comfortable they are with sending their kids back, how comfortable they are with the different levels of public health sort of gauge. And so I think it's really wise of us as a district to go slowly, to be intentional, to make sure that we are moving forward in ways that are sustainable, both for our staff and for our students, and that are thoughtful about what we can do well at any one time, right? Because we can't do it all. And so moving forward with the small cohorts, I think, is a very wise decision, and bringing our elementary school students back so that they can, begin to connect to school in more traditional ways is hopefully something that we'll be able to take action on Tuesday. But I really do appreciate all of the staff time and attention. Dr. Rice, your leadership on these things is invaluable. I know you've spent many, many, many hours, not just talking through this with staff, but also getting guidance from your peers around the state and from public health. And I really, really appreciate your thoughtfulness on all of these things. As with everything you've done so far, it's very thorough, and that's very much appreciated.
Thank you so much, Sabrina. Can I take a minute to recognize someone else, though? We have an esteemed gentleman in our midst today who repeatedly has stepped up over the years to fill in spots where we have needed help and leadership and guidance, and he does it with the utmost professionalism. He is such a first-class leader and gentleman, and he is finishing up his assignment out at Anacapa, and he's on the call today. And Peter, I just want to say thank you to you for all you've done for this district over so many years, and especially this most recent assignment. You're amazing. Thank you, Peter.
Mr. Geary, would you like to say anything?
That's unexpected and very much appreciated. Just that it's great to be part of this family, and it's hard to let go of this family. I feel like I'm the school's grandpa and the district's grandpa, and very much feel like that way. I just found out that Pavel was my assistant principal, was born the same year as my middle daughter. So yeah, but it's always a pleasure to serve the district. I had a hard time leaving when I left, so that's why I'm glad I was never completely pushed off to the side. Thank you so much.
You will never be pushed off to the side. You're welcome to come back anytime. So unless there is a need to discuss anything else, I'll accept a motion to adjourn.
So moved.
Second.
A vote as follows. Trustee Dannenberg,
Yes.
Trustee Almaraz,
Yes.
Trustee Lomax,
Yes.
Trustee Maran,
Yes.
and Trustee Rodriguez.
Yes.
A motion carries 5-0.
Great. Well, thank you all. I hope you have a wonderful weekend, and look forward to seeing you next week. Oh, and thanks to TDC Studios. I almost forgot. Thank you so much for making our meeting available to members of the public who can watch it via their YouTube channel. Always appreciate VACE and all that they do to support the district. So thank you.